Good evening, all. Welcome to the Vatakandaka National Level Paper and Poster Presentation presented by Team Sameeksha. Now, before get start, let me introduce our faculties. First, I would like to invite our Agatanandra panel, Dr. Ashwadi S., Dr. Veena Nath, and Dr. Revati Raj. Next, I invite our Swastham Vrta panel, Dr. Sujitra, Dr. Rashmi R, and Dr. Sridevi. Next, I invite our Prasudi Tandra panel, Dr. Deepthi, Dr. Sri Lakshmi, and Dr. Krishna Priya. Next, I would like to invite our Kaumara Pritya panel, Dr. R.D. Dinashekar, Dr. Sulata Nandakumar, and Dr. Rajneesh. Next, let me invite our Kaya Chikitsa panel, Dr. Ramesh P, Dr. Bhagya Soman, and Dr. Kavida Raj. And next, I invite our Shala Kitandra panel, Dr. Arya Soji, Dr. Vaishak Raj, and Dr. Arya K. Panikar. Next, I would like to invite our Dravya Guna panel, Dr. Vishwanand Patil, Dr. Sri Rekha, and Dr. Kalyani. Next, I invite Sharladandra panel, Dr. Arun Kishan, Dr. Krishnananda CR, and Dr. Usha. Now, I invite Panchakarma panel, Dr. Jinsi Joseph, Dr. Mahesh, and Dr. Ashwini Somasundaram. And now I invite our Samhita panel, Dr. Rama Devi S. and Dr. Kavida Sajish. And I would like to invite our Rasha Baishajya panel, Dr. Remya Ji and Dr. Sindhu Lakshmi. And finally, I would like to invite our Rajana Sharida panel members, Dr. Vivek, Dr. Sri Lakshmi, and Dr. Krishna Priya. So, our work is the presentation of our capabilities. So, I wish all our participants to perform their level best. So, first we have a paper presentation on the topic Sthanika Chikitsa in Prasudi and Stri Roga. And for the presentation, I would like to invite Dr. Vidya Sambhaji Jadhav.
Hello. Hello.
Hello, doctor.
Hi, yes, I'm sharing my PPT. Hello.
Yes,
Hello.
doctor, you are audible.
Hi, yes, ma'am. Yes. Are you audible, ma'am?
Yes, doctor, please start.
I am unable to share my PPT. Can I share PPT on WhatsApp?
Yeah, please send to Dr. Sabin.
I have no.
So you can present next. Please be there.
Yes, ma'am. Yes, yes.
So before get start, let me remind you something. Dear participants, do you have a total 8 minutes for your presentation? Please note the time. And next, I would like to invite our next participant, Dr. Mahesh Pandit, for the paper presentation on the topic, a study of Ayurvedic diet plan in Grahani. Dr. Mahesh. Hello, Dr. Mahesh. So next I invite Dr. Rucha for the presentation on the topic Raktavaha Srotas. Hello, Dr. Rucha. Dear participants, if you are there, please respond. So next, I would like to invite Dr. Sneha Suryakant for the paper presentation on the topic, a case study on Adhimanda and its management. Dr. Sneha Suryakant. Hello, Dr. Sneha.
Hello.
Hello, Dr. Sneha.
Hello. Yes, ma'am.
Yes, you are audible, doctor.
Yes, ma'am. Audible. Actually, I can't receive any timing related to this. Can give me just 15 minutes to join?
Yeah, sure, doctor. After
O-
15 minutes, please be there.
Okay, ma'am.
Okay, so next I invite Dr. Ranganath for the paper presentation on the topic, a pragmatic approach to the management of Manovikara. I invite Dr. Ranganath.
Hello.
Hello, doctor. Doctor, you
Hello.
can present
Whether
now.
it's audible?
Yes, doctor.
Hello.
Yes, doctor, you are audible. Please start.
Okay. I will present my topic. Few minutes.
Hello, Dr. Ranganath.
Yes, ma'am. I'm not getting my presentation.
Doctor, please try again.
Okay.
Okay, Dr. Vidya, are you there? Hello, Dr. Vidya. Hello, Dr. Vidya.
Yes, ma'am. Yes. Hello.
Did you share the PPT, doctor?
Ma'am, I'm unable to share the PPT.
I will send the number. Please
Yes,
send.
yes, ma'am. Yes,
Okay, doctor.
yes, yes. Only 2 minutes. Ma'am, please send the number, WhatsApp number.
Okay, doctor.
956773 पे सेंड कर सकते हो क्या?
No, doctor. I will send the number now.
Yes, yes, yes.
Hello, Dr. Ranganath. Hello, Dr. Ranganath.
Hello.
Hello,
Hello.
Dr.
Hello, yes,
Ranganath.
ma'am. Yes, ma'am. Yes, ma'am.
Doctor,
I can't find my PPT in my drive. I'm searching.
Hello.
Dr. Vidya, please be there.
Yes, ma'am.
Dr. Ranganath, can you present now?
Yes, ma'am. No, ma'am. I can't find my PPTs in my drive. I'm searching. Give me a
Okay,
minute, ma'am.
doctor, please try it again. Please be there.
Okay.
You can present
Okay.
later.
Ma'am.
Okay.
Hello.
Yes, doctor. Yes,
Ma'am,
doctor.
please send the WhatsApp number.
I already sent, doctor. Please check the chat box.
Ma'am, I didn't receive, ma'am.
Dr. Vidya Jadhav,
Yes, ma'am. Yes.
uh, please check, doctor. I will send
Ma'am,
it again.
ma'am, I didn't receive.
Okay, I will send it again. Please be there. So
Yes,
we don't
ma'am.
have much time. I'm inviting the next presenter.
Yes, ma'am.
आणि मग त्याला वाड्यामध्ये काय त्याला बसून ठेवलं असतं काय आता काम करायचं त्याचं कामच करावं लागतं ना
I invite Dr. Sinchan for the paper presentation on the topic Ayurvedic nutrition and health with a focus on Patya.
Hello.
Hello, doctor.
Hello.
Yes, doctor, you are audible.
Okay. Ma'am, I have shared the PPT already.
Doctor, you can share it now and present it.
Share through WhatsApp. Shall I
So-
share through WhatsApp?
No, is there any problem for sharing now?
No, I will share it. I have shared it through mail also, through WhatsApp also.
Doctor, you have to share your PPT in the presentation.
Can you send me the WhatsApp number? Can you tell me? Yeah, 1 minute, I'll share it.
Hello, Dr. Sinjan.
Hello.
Please start.
Actually, Dr. Rangnath is presenting. He has shared his PPT.
Hello, Dr. Ranganath. Hello, Dr. Ranganath. Hello, Dr. Ranganath.
Can you hear?
Hello, Dr. Ranganath.
Hello.
Hello, Doctor. Are you
Hello.
sharing the PPT now?
Yes, yes, I will share, ma'am. Now.
Hello, Doctor.
Hello. Whether you are able
Hello,
to
Doctor. Are
hear,
you
ma'am?
sharing the PPT now?
Yes, I am
Yes,
sharing, ma'am.
Doctor. You
Whether
are
you are
audible.
able to see? Yeah,
Uh,
it's audible.
Yeah, it's visible, Doctor. Before
It's visible.
sharing or presenting, please inform us because there is
Hmm.
already a participant is waiting.
No. Actually, I am trying, ma'am. It came popped up like that.
Yeah, because I already called another one. So before sharing, you have to inform us.
Okay.
Please start, Doctor.
Okay. Good evening to everyone. You can see my screen, no, ma'am?
Yes,
Hello.
Doctor.
Okay.
Yes, it's
This
visible,
is
Doctor.
like a. Okay. Good evening to everyone. This is Dr. Rangnath, second year PG scholar from SSRMC Inchal, Belgaum. Okay. I am going to present today a pragmatic approach to the management of Manovicharas with special reference to Rasabhaishajya Yogas under the guidance of Dr. Mahantesh Rudrapuri, Professor and Head, Department of RSPK, SSRMC and H. Inchal, Belgaum. Introduction, ma'am. First, we will see that what are the Manovikaras and how they will occur. Manovikaras are caused due to the druti of Manovasrota, where the druti smriti of a person affected by impairment of Sharirik and Manasika dosha. In classic, we can see like Manovikaras are like Unmada, Apasmara, and Atatva Nivesha. These are three major Manovikaras, and like Brahma, Sanyasa, Vibrama, Madatyaya, Apatanaka are also explained by different acharyas. Now we will see that management of Manovikaras. In modern, they will manage like psychiatric conditions include somatic treatment, ECT, transcranial stimulation, and vagus nerve stimulation. In Ayurveda, it's a pragmatic approach like Daivaprasya Chikitsa, Yuktivapasya Chikitsa, and Satovajaya Chikitsa. This presentation will be more concentrated with Samana Chikitsa, ma'am, not like Daivaprasya and Yuktivapasya. Like using Rasabhaishya yogas like Smriti Sagar Rasa, Manasa Mitravati, and Saraswatarishta and Chaturbija Rasa. First, we have to attain the Sattva Chikitsa, means we have to treat first impaired Rajas and Tamas. From that impaired, if we treat like impaired Rajas and Tamas, we will bring like assurance, replacement of emotions, regulation of thought process, like that. And if we do means, it will do the Mano Nigraha. From Mano Nigraha, it will increase the Sattva Guna, and thus we attain the Sattva Chikitsa. Like we can see now list of Manovikaras like Apasmara, Unmada, Atatva Nivesha, Brahma, Sanyasa, Vibrama, and Apatanaka. Shamanotsadis we will use like Saraswatarishta, Manasa Mitravati, Mutisagar Rasa, Samira Pannagrasa, Chaturbija Rasa. First we will see on Saraswatarishta, ma'am. Saraswatarishta is a well-known Ayurvedic formulation which is used for this one neurological condition, and disorders like slurred speech, Parkinson's, anxiety, and Alzheimer's disease. It is also best Sudhya, Balya, Rasayana, and Vata Vijnanaka, Pakendra, Chitta Pragdayaka. The main ingredients in Saraswatarishta is Swarnabhasma. It acts on good antioxidant on stressed condition. This is about Saraswatarishta. Next, we will see about Manasa Mitra Vatakam. This reference is Sahasra Yoga. It's used for the treatment of psychosomatic diseases and anxiety, neurosis, and stress. The components are same as Saraswatarishta, but is best Vedana Stapana. The calcium components like Rajata and all with a good memory enhancer. So we can use this Manasa Mitra Vatakam in Manovikara. Next, we will come to Samira Pannagrasa. The drug is mainly indicated in Apasmara with Kapasanga. The drug is mainly it will act on Vata Kapahara, ma'am. The arsenic compounds clears Kapasanga and stimulate brain. Next, the Chaturbija Rasa. Basic Ayurveda Chaturbija Rasa with gold is an Ayurvedic medicine, ma'am. Contains potent herb like minerals which helps in chronic cases of fever, epilepsy, and psychotic disorders. It is useful in extreme cases of weakness, trembling, and weakness of limbs. Along with that, it will also do the Deepana, Patana, and Vatanulomukha. It contains it's like Erenda and Kasturi. It does the Kapha Nisaraka. Now we will do the quick glance on these Samanausadis on what we use on Manavikaras. Like Saraswatarishta, we can use in Sannipataja Manoroga with Kapavata, Kapavrata Vata, and Manasa Mitra Vataka, Sannipataja Manoroga, depression or anxiety, where memory loss is there. We can use this Manasa Mitra Vataka. Then Samira Pannagrasa, where Kapaja Unmaja, where there is Kapasanga and Kapajaka and Kapha Nisaraka activity is needed. We can use this Samira Pannagrasa. And Chaturbija Rasa, Vata Kapaja Manoroga, where there is depression along with memory loss, we can use Chaturbija. And what I am giving conclusion is, these Rasayogas are quicker in absorption, faster in assimilation, and have instant action, ma'am. These can penetrate to deeper and minute parts of our body to exert instant results. Their usage gain more popularity and acceptance in management of debilitating, dreadful diseases like Unmada and Apasmara. All these qualified and properties of Rasavajis play a major role and significant role in achieving the criteria Samprapti Bhedana, thereby facilitating, preventing, and complication early recovery from the illness and also improve quality of life. Due importance should be given to Sattva Chikitsa and Sadrutam. Thank you.
Thank you, Dr. Ranganath. It was a comprehensive presentation.
Thank you, ma'am. Thank you.
So, Dr. Sinjan, can you present next?
Yeah, ma'am. I'll share my PPT. Ma'am, I'm unable to share it. Can you give me 5 minutes? Hello?
Okay, doctor.
Hello. Hello.
Hello.
Hi, ma'am. I Dr. Vidya. I sent
Yes,
PPT on
doctor.
WhatsApp.
Yeah, I received, doctor. Sorry, we do have some technical problem. So, doctor, please be there. I can call you now. I can call you after few presentation.
Yes, ma'am.
So next I invite Dr. Srishaila Swami for the presentation on the topic significance of mental health in Nidra.
Good evening, ma'am.
Good evening, doctor.
Yes, ma'am. I will share my PPT. 1 minute, ma'am. Ma'am, 1 minute. Hello.
Hello, doctor.
Hello, ma'am. I am facing some difficulty to share, ma'am.
Okay, doctor. So please, you can try it again after some time. Now I
Okay.
can call you another participant.
Hello.
Hello,
Hello.
doctor.
Ma'am, it is Dr. Sinchana. Can I present it now?
Yeah, sure, doctor. Please.
Hello.
Yes, doctor, it's visible.
Okay. 1 minute. Hello, good evening everyone. Myself Dr. Sinchan, PG Scholar, Rachana Sharira Department from SSRMC Inchal. Today I'm going to present a topic on Ayurvedic nutrition and health with a focus on Patya and Apatya. Guided by my HOD, Dr. Mahesh Patil sir, Rachana Sharira Department, SSRMC Inchal. Coming to the introduction, Ayurveda places special focus on Ahara and believes that healthy Ahara nourishes the body, mind and soul. Every individual is different from each other. The pattern of Ahara will also differ from one person to another. As told in Vaidya Jivana, Patye sati gatartasya kim aushadha nishevanam, patye asati gatartasya kim aushadha nishevanam. If patient intakes wholesome food, then there is no need of any medicine. In the same way, if the patient consumes an unwholesome food, there will be no effect of any patya in that patient. Next, Ayurvedic nutrition depends on Prakriti, Sattva, Raja, Tama, Rasa, Kala, Tridoshas, and all other aspects. Importance of Ayurvedic nutrition. Coming to the aim of Ayurveda, it is told as Swastasya Swasthya Rakshanam, Aturasya Vikara Prashamanam. To achieve this aim, the concept of Patya comes very important. Next, Swastha, Samadosha Samagnischa, Samadhatu Malakriyaha, Prasanna Atmendriya Manaha, Swastha Ityabhidiyate. Charaka in Chikisasthana, first chapter, Rasayana Pada. As I explained, Patya is the synonym of Chikitsa. Even he has told that Chiyate Annadibi iti Kaya, nourishment to body is obtained continuously by the consumption of Patyahara. How this health is achieved through Patya? By following Patya, we will achieve Prasanna Atmendriya Manaha, Samagni, and Samadhatu, Samadoshas. Concept of Patya and Apatya. According to Vachaspati, Patya means Pata or the Marga. According to Charaka, Patyam Pato Anopetum, Yadyacha Uktam Manasa Priyam, Yacha Apriyam Apatyam Cha Niyatam Tanna Lakshate, Matra Kala Kriya Bhumi, Deha Dosha Gunantaram, Prapya Taddadi, Drishyante, Te Bhavas Tata Tata. Patya and Apatya. Patya can be divided as Patya for a healthy person, Patya and Apatya for a diseased person. Most wholesome Patya, that is Patyatama, and the Apatyatama is divided as Apatya for a healthy person, Apatyatama or a most unwholesome Patya, and Patya is also divided according to Rutu. Patya and Apatya for a healthy person. Patya is told as Shashtika Shali Mudkanscha, Saindavamalake Yavan, Antariksha Payab Sarpi Jangalam, Madhucha Abhyase. Apatya is also mentioned in Charaka Samhita as Vallura Shushka Shakani, Shalukani Bisanicha, Nabhyase Kauravam Mamsam, Krisham Nayopajayate, Kuchikamscha Kilatamscha, Shaukaram Gavya Mahishe, Masyan Dadicha Mashamcha, Yavakamscha Na Shilayet. Next, coming to the category of Hitatama and Ahitatama Patyas, Charaka has described among the Shukadanya, Lohita Shali as the Hitatama, and among Shamidanya, Mudga as Ahitatama. Mudga as Hitatama. In the same way, he has divided different types of Patya. Next, coming to Ahitatama Ahara. In Shukadanya, he has described Yavaka as Ahitatama. In Shamidanya, Masha as the Ahitatama Ahara. Patya and Apatya according to Rutucharya. In the Hemanta Rutu, Patya is considered as Snigdha Ahara, Madira, etc. Apatya is Lagu Ahara. In the Shishira, same as Hemanta. And the Lagu Ahara as Apatyatama considered in Hemanta Rutu. Vasanta Rutu, Lagu Ahara Sevana. In the Apatya, he has considered Divaswapna and Snigdha Ahara. In the Grishma Rutu, Divaswapna, etc. is considered as Patya. And Katurasa Sevana is considered as the Apatya. Varsha Rutu, Lagu Ahara, Amla Lavana Yukta Ahara is considered as Patya. Apatya is Divaswapna, excessive exercises. Sharad Rutu, Madhura Lagu and Shita Ahara Sevana is considered as Patya. Apatya is Atapa Sevana, etc. Next, Patya and Apatya according to the diseases. Patya in Jwara is Yavagu, Laja. Apatya in Jvara is Divaswapna. According to disease, Patya and Apatya will always be changing. Next, benefits of Patya is explained by Charaka in Sutrasthana Annapana Vidhi Adhyaya. He tells Varna Prasada Sauswaryam, Jeevitam Pratibha Sukham. Explained Shariram Upachayam Balasvarna Sukayusha, Yojayati Sharira Dhatunam, Ujayati Cha. These are the benefits of Patya. To decide Patya for an individual, we have to analyze his Prakriti, Koshta, Kala, etc. Example, Lohita Shali is considered as Sadapatya, but same Lohita Shali will become Apatya in Hemanta Rutu due to his Laguguna. Coming to the conclusion, as we know, if patient intakes wholesome food, then there is no need of medicine. And if a patient continuously consumes unwholesome food, then also there is no need of medicine, as told by Vaidya Jivana. Patye sati gatartasya kim aushadha nishevanam. Patye asati gatartasya kim aushadha nishevanam. Thank you.
Thank you, doctor.
Okay.
Next, I would like to invite Dr. Sneha Suryakant for presenting a case study on Adimanda and its management. Hello,
Am I
Dr.
audible?
Sneha.
Yes, ma'am.
Yes,
Am I
doctor.
audible?
Yes.
Actually, another one sharing their screen,
Doctor,
so I can't.
Okay. Dr. Sri Shaila Swami. Hello, Dr. Sri Shaila Swami. Hello, doctor. Hello, doctor. You can present next. Please be there.
Okay. Is it my screen?
Dr. Sri Shaila Swami. Doctor with Dr. Surya.
It's ma'am Sneha.
Okay. Sorry, Dr. Sneha. You can present now.
Okay. Can you see my slides?
No, it's not visible, doctor.
Just a minute, ma'am. Is it visible?
Yes, it's visible, doctor.
Okay. Myself is Dr. Sneha I from PG Scholar from Sumatibai Shah Ayurvedic Mahavidyalaya, Hadapsar. I'm presenting a case study on Adimanta and its management. The disease Adimanta presents the features that are similar to glaucoma in modern science. It is a neurodegenerative disorder of the optic nerve. It is not a single disease process, but a group of disorders characterized by the progressive optic neuropathy, irreversible visual field, the raised intraocular pressure, and the mechanism by which an elevated intraocular pressure damages the nerve fibers. And their raised IOP causes the mechanical damage to the optic nerve axons, and also the raised IOP causes ischemia of the nerve axons by the reducing blood flow to it. There is a progressive retinal ganglion cell death, and the progressive peripheral visual field loss are occurred. In this way, the mechanism by which the IOP raise and the pressure is exerts on the wall of the retina and how to damage the optic nerve. Then how to the normal field vision of the normal person and how to see the glaucoma patient. The peripheral vision is deteriorated. Then the Adimanta, it is included in Sarvagat Netra Roga, that is the disease applicating all parts of the eye instead of appearing in particular parts of the eye. Symptoms: the severe pain in the eye, like the Utpatta Evam, that's the feeling of the someone trying to pull out the eyes. And Atyartham Netram Nirmartha, that is the crushing type of pain or the churning type of pain. And third one is the Shirasardham, pain in the half portion of the head. The types of Adimanta: Vata Adimanta, Pittach, Kapach, and the Rakta Adimanta. The symptoms caused due to the involved dosha will form the different complexes in the types of the Adimanta. The material methods: a male patient of the age 27 years in the OPD of the Shalaketan from SJK Hadapsar Pune, complaining of diminution of the vision of the both eyes, shirashul, heaviness in the eyes, and the redness of the eyes. Thus, there is no any systemic history or the systemic illness in patient, and the ophthalmic history on it. He is on the anti-glaucoma treatment or a surgical history having the right eye trabeculectomy done before the 5-6 years ago, and he can't have any drug allergy or any addiction. Then ophthalmic findings: the lids of the both eyes are the normal, the sclera and conjunctiva and mild congestion in right eye and the left more than the right in left eye. The cornea of both eyes are clear. The pupil of the right eye, the sluggish reacting to light, and in the right eye, the semi-dilated but not reacting to light. The lens having immature cataract, the posterior subcapsular changes, and the left eye having cataracts like the anterior polar changes. The anterior chamber of the both eyes are the shallow, and the vision of the right eye is 5 feet, and the left eye there is no any perception of light in any quadrant. Then an intraocular pressure of the right eye is 7.1 mm of Hg, and the left eye is 15 mm of Hg. And in fundoscopy finding, we see the optic disc of the right and left eye almost the chalky white, but in a right eye there is a CD ratio of 0.9, and the left eye complete optic atrophy. Macula of the bilateral eye, the FR is dull, and the peripheral retina is normal. Then how to treat? Then the goal of the treatment is to slow the rate of progression throughout the patient's lifetime in order to maintain visual function and the related quality of the life at sustainable cost, or to reduce the intraocular pressure. The treatment plan is there are 3 combinations. In first combination, Tapyadiloho, Ashwagandha, that is Withania somnifera, Guduchi, that's Giloy Tinospora cardifolia, and the Saptamrutlaha with Patyadi Kada and Kalis Vanodan at morning or at night after meal. Second one is Triphala Churna plus Avipattikar Churna with black resins and the Kalwa Ratro, that is at a bedtime. This 1 and 2 is given, combination 1 and the combination 2 is given for the 1 month. Then Jaloka Ucharan, that is leech therapy at Vam Shankha Pradeshi once a week. After 1 month, the combination 1 is continue, combination 2 also with continue, and third one add is the Pravaya Panchamrut Vati is twice BD. And continue the Jalaka Ucharana leech therapy once a week. After 2 months, combination 1 is continue, and the second one change to Triphala Churna plus ST Madhu, that is Glyceria glabra Churna plus Amalki Imlica Opinilysis Churna with Mahatriphala Grutha at night. And third one is Shirashuladi Vatti BD, and also continue the Jalakvacharan therapy once a week. During treatment, we found that the patient get progressive relief from their symptoms, the intraocular pressure progressively decrease, the vision is not deteriorated, and the bilateral pupils start to reacting to light. It's not normal, but start reacting to light. After treatment of 4 months, the intraocular pressure in right eye is 5.9 mm, which in left eye reduced 15 to 35.8, and the pupils of the right eye normal size reacting to light, and the left eye semi-dilated. First time it was not any react to the light, but after treatment it is semi-dilated sluggish reacting to light. Vision of the right eye is 6 to 7 feet. Left eye there is no change in the vision. Observation before treatment: patient having redness, pain, heaviness, headache, and the pupils which are not reacting to light. And it is changed after treatment. Its redness is reduced, totally reduced, pain also reduced, heaviness, headache also reduced, and the pupils are reacting to light. In IOP changes, right eye IOP 7.1, after treatment right eye IOP 5.9 mm of Hg. In left eye IOP is raised up to 50 mm of G, it's reduced to 30.8 mm of Hg. The diagnosis for the perimetry is given the before treatment and the after treatment. There is a changes in the visual field. Here we see that the black portion of that area is reduced, it becomes a white or the gray. That's in this field the vision is increased. And here is the medial mean index is changed to then discussion. Tapyatil loh is act as a rakta prasadak, improves the quality of the blood. Its balya, increasing strength, and deepen and the pachan. It nourishes the dhatu by igniting dhatwagni. It improves strength of the chakshurendriya. Then saptamrut loh is used to improve the power of the netra. It nourishes the every part in the layer of the eye. It acts as a tridoshagna. It nourishes the rasadhatu and the raktadhatu. Triphala Navipattikar Churna, both having properties like Dipan Rechan or the Pachan. The Ashwagandha having rasa like Katu, Tikta, Kashai, Virya, and Ushna. According to Acharya Charak, it is included in Virechanopak Dravya. And according to Acharya Sushruta, Ashwagandha included in Urdhva Bhagahar Samshodhana Dravya. The Giloy having rasa like Katu Tikta Kashai, it acts as a balya, rasayan, chakshusha, that is improve the eyesight, and the Patyati Kada, Shirashuladi Kada are used to reduce the headache. Jalakaucharan at leech therapy. During leech therapy, blood is sucked out, thereby the reducing inflammation. This leads to reduction in the pressure. During blood sucking through veins by the leeches, the biological active substance acts on the organ, improve and promote the blood circulation in the certain organs. The inflammatory immunostimulating action raise nutrition tissue and the strengthen the tissue immunity. The saliva of the leech contains bioactive substances which are vasodilators, analgesic and anti-inflammatory. It is indicated in Pitta Pradhan Rakta Dosha Drushti Vikaraj. The leech sucks out the impure blood from the affected area, and then affected area gets perfused by the oxygenated blood, which helps in arresting tissue damage. In this method, we treat the disease Adhimanta. And the conclusion, there are natural products and the leech therapy are effective medication can be used for the treatment of the disease like the Adhimanta. These remedies are being practiced in the ancient time and the cost effective and the easily available. Thank you.
Thank you, doctor. So, Dr. Sri Shaila Swami.
Yes, ma'am.
Hello, can you present now?
Yes, ma'am.
So next I invite Dr. Sri Shaila Swami for presenting the topic Significance of Mental Health in Nidra.
Hello.
Yes, doctor.
1 minute. Ma'am, is my PPT visible, ma'am? Hello.
Yes, doctor, it's visible.
Okay, myself, Srishail Swami as convener. So I am from Department of Kaya Chikitsa. So I'm dealing with the topic significance of mental health in Nidra. Is it visible, no, ma'am?
Yes,
Hello.
doctor. Please continue.
Okay, thank you. So first we'll see introduction. Definitions. Definition of health. Definition of mental health. Definition of health according to Ayurveda. Importance of mental health and manas. So according to definition of health, according to WHO, health is a state of completely physical, mental, and social well-being, and not merely the absence of infirmity. Definition of mental health according to WHO. It is a state of well-being in which the individual realizes his or her own abilities, can cope up with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So we'll see definition of health according to Ayurveda. Maintenance of equilibrium of doshas, three doshas, that is Vata, Pitta and Kapha, Jatra, Agni, digestive fire, and Sapta Dhatus, bodily tissues, the Rasa, Rakta, Mamsa, Meda, Asti, Majja and Shukra. And Trimalas, Sveda, Mala and Purisha. Atma, Indriyas, Manas, together makes person healthy and remains full of bliss. Importance of mental health. In recent years, there has been increasing acknowledgement of important role. Mental health plays a major role in achieving global development goals. Depression is one of the leading causes of disability. Suicide is the second leading cause of death of age 15 to 29 years old. Psychiatry in Ayurveda integrates mind, body and soul. Physical imbalances can disturb mental state, while mental illness lead to disruption of body functions. In context, mentioned in Charaka Samhita, Vishado, Rogavardhanam, Agra, Vishada, and Avasada. Vishada and Avasada are two conditions which are closely similar to depression in the form of mental health. Now we will see importance of Manas. The relation between Manas and Ojas is very relevant in the manner of Manas Roga, because both Ojas and Manas are seated in heart. Ojas is depleted by mental emotions such as anger and grief, and the person becomes fearful, worried, and his faculties will not be functioning properly. Excess of shoka, krodha, chinta, kama, lobha, moha, irsha, abhimana, mada, baya are some of the negative emotions which can contribute to mental imbalance. The influence of manas is dealt even in the embryonic stage. Manifestation of manas occurs during 5th month of pregnancy in fetal body, indicates the coexistence nature of mind and body. Need of mental poison for drug action. Ayurveda says that no one who has not rid of the evils of both mind and body, beginning with gross ones. Vayu, which is one of the tridosha. So Vayu increases that depresses mind, give rise to fear, grief, stupor, helplessness, insomnia, delirium. Discussion. Causes of anidra. Disturbed sleep. Manasika karanas of anidra in general are manastapo, baya, chinta, vyata, harsha, shoka, utkanta, kama, lobha. Charaka opined that increase of sattva guna, control over tamaguna, uncomfortable bed, fasting, baya, krodha leads to anidra. Shushuta felt that vata, pitta, manastapo, kshaya and abhigat. Harita mentioned that mental causes of anidra are chinta, lobha and baya. Physiology of nidra. Some chemicals like lactic acid, acetylcholine, bromide, or specific fatty toxins were supposed to accumulate during working, which irritates the nerve cells of brain and causes of sleep as a result. So there seems to be some center or centers located below midpointine level of brainstem that actively cause sleeping by inhibiting other parts of the brain. The term sleep-wake cycle means in 24 hours period, a man sleeps how many hours and how many hours remains awake. For example, if a person sleeps 7 hours and remains 17 hours wake, then the sleep-wake cycle of that person is 7 by 17. Then this is also called as circadian clock. Physiology of anidra. Kapakshaya or tamoguna kshaya, they fail to fill up Sanyavaha Srotas. On the other hand, vitiated Vata dosha lodged in Majja Dhatu. Shiro Majja, a part of Sanyavaha Srotas, which is not filled up with Kapha and Tamoguna, thus resulting in Anidra. Disturbances of sleep. According to Ashtanga Hridaya Sutrasthana 7th chapter, he mentioned about the Trayopastambhas, 3 pillars of life, that is Ahara, Nidra and Brahmacharya. Proper rest is essential for well-being of any person. The body utilizes sleep as an opportunity to use its energy for healing and repairing damage to the body that accumulated during the walking hours. Too little sleep upsets Vata dosha, while too much sleep disturb Kapha dosha. Disturbance of Vata dosha results in weaker tissues that are more susceptible to injury. Disturbance of Kapha dosha results in tissues and become excessive, stagnant, lethargic and immobile. In general, it is best to align our sleeping patterns with cycles of day and night. Results. Chikitsa of Manasika Roga, Chikitsa of Anidra, other methods of Chikitsa. Chikitsa of Manasika Roga. Ayurvedic recommends 3 types of Chikitsa for the Manasika Roga. Daiva Vaprashraya Chikitsa, that is divine or spiritual therapy. Yukti Vaprashraya Chikitsa, logical therapy. Sattva Avajaya Chikitsa, psychotherapy. So, what is the Daiva Vaprashraya Chikitsa? The measures like mantra, aushadhi, mani, mangala, bali, homa, upahara, praushchita, upavasa, swastyayana, pranipata, gamana. Next, Yukti Vapasraya Chikitsa. It is based on the Ahara and Aushadha. Ahara, Kshira, Gruta, Draksha, Maisha Mamsa, Shali, Goduma, Pishtanna, Madura, Snigdha Bhojana, Ikshu. Aushadha, Shamana, Shodhana, Rasayana therapies are to be followed. Shamana, Brahmi Gruta, Kalyanaka Gruta, Panchagavya Gruta, Smruti Sagara Rasa, Saraswata Churna, Vacha, Tagara, Sarpaganda, Jatamansi, Bala. Rasayana, Ashwagandha, Chavanaprash, Brahmi Rasayana, Shatavari Leha, Kushmanda Rasayana. Shodhana, Virechana, Vasti, Nasya, Abhyanga, Dara, that is Shira, Taila or Takrarius, Shiropichu, Shirolepa. Sattva Avajaya Chikitsa, psychotherapy. The best way to treat this with Gnana, Vijnana, Dhairya, Smruti and Samadhi. Apart from these measures like calming the patient with assurances and words of moral support, shocking him by announcing to lose the thing he holds dear or showing him some wonderment, threatening him by physical torture have been mentioned. Chikitsa of Anidra. Ayurveda has a potent approach towards the treatment of anidra by both internal and external medications. Medhya drugs are recommended for various psychosomatic and psychiatric disorders. Most of the formulations acting on mind are ghee-based. It is well established that the drugs to have its action on the brain should have the capacity to cross the blood-brain barrier, and for that purpose, ghee is the best drug. According to Ayurveda, Abhyanga, Udvartana, Snana, Shirodhara, Karna Purana, Akshitarpana, Nasya, Mano, Prasadakara drugs. Nasya is easy and effective therapy for anidra, which can be additionally applied along with the continuous treatment of chronic diseases conditions. Other methods of treatment for manorogas. Vyayama. Anything that brings about tiredness to the body is called Vyayama. After Vyayama, the digestive power increased, body stability increased, lightness removes laziness, tiredness is relieved, thirst decreased. benefits and limits of Vyayama. It leads to creation of new neurons in critical areas of brain, which makes the brain more active and enables better memory and concentration. It can increase Agni, digestion and metabolism, which we do more work. Our body temperature increases, including that the Pitta is increased. Vata is the cause of movement. When Pitta along with Vata increases, it leads to improvement of Agni. Too much of Vyayama causes Vata dosha aggravation, leading to lack of sleep. So it is not advised to indulge in excess of exercise. Conclusion. Prevention. How to prevent the Manasika Rogas. There are measures like Dinacharya, that following daily regimen, Rutucharya, seasonal regimen, Sadruta, code of virtues, and Roga Anutpadana, prevention of disease, and Annapana Vidhi, rules pertaining to food and drinks. Those who speak truth, refrains from overindulgence in alcohol and meat, herds none, avoids overstrain, fair spoken, always compensate, eating compatible foods will enjoy the benefits of sound mental health. This would also richly contribute in preventing and treating many psychosomatic conditions like peptic ulcer, bronchitis, blood pressure, eczema, and diabetes. All these measures are aimed at bestowing relation and mental equipoise, which are the basic prerequisites of sound mind. These are particularly relevant to our times when we are forced to battle continuously against stress and strain for our very survival. So, thank you, ma'am.
Thank you, doctor, for this wonderful presentation. Once again, thank you, Dr. Sri Shaila Swami.
Thank you,
Next,
ma'am.
I would like to invite Dr. Mahandesh for the paper presentation on the topic Ayurvedic approach to Parkinson's disease. I invite Dr. Mahandesh. Hello, Dr. Mahandesh. So next, I invite Dr. Mahija bin Munir
Yes, ma'am.
for the paper presentation.
Hello, ma'am.
Doctor.
Hello, ma'am. Am I audible?
Doctor, please. Yes, doctor. Doctor, please share the PPT.
Okay, ma'am. Just a minute. Good evening, everyone. Today I am presenting my observation study on effect of myopia associated with poor sleep and screen time. I am Dr. Mahjabin Jikre from Shalakatantra Department, PG final year. Introduction. Ayurveda consists of 8 branches in which treatment of diseases are described. Urdhvanga Chikitsa deals with treatment of diseases head, inclusion of eyes, ears, nose, teeth. Shalakatantra is name of that branch which describe the diseases and treatment of parts above the shoulders such as ear, eyes, nose. Urdhvanga contains um, all 4 out of 5 Jnanendriya. Human depends on sense organs. Among these, Netra is Pradhan. Indriya said by Acharya. Acharya Sushruta and Vagbhata says various diseases of Netra, in which Timari is one of the main disease of Drishtigat Rogas. Timire is characterized by Avyaktam Akshirupam, Vyaktam Pyayate Nimitam, Duram Akshimattate. Clear object also appear blurred without any reason. The sign and symptoms are more similar to myopia. The sign and symptoms of myopia are blurriness, difficulty to discern vision, and visual hallucination. The study indicates that people with short-sightedness have more delayed circadian rhythm and lower production of melatonin hormone. Uh, Disease review. Timir. Acharya Sushruta has described in all 6 patala, out of which 2 patal are outer, 4 patal are inner. A very severe and chronic disease called thymic is observed generated in this internal patala. Out of these inner four patal, first patal tejo jalashrit, second is mansashrit, third is medashrit, and fourth is astyashrit. The feature of first and second patal are collectively called timir. Third patal is kaj, fourth patal is linganash, respectively. Sushruta has mentioned six types of timir: Vatash, Pittash, Kaphash, Sanipatash, Sansargaj, and Parimlai. Causes of Timir. Acharya Charaka classified the causes as overuse, misuse, disuse of sense organ, and regarded as volitation, transgression, that is, excessive gazing at the bright object, is excessive use, avoiding looking altogether is disuse, and seeing too near, too distant, frightfulness, wonderfulness, dislike, disgust. The form and terrifying object is perverted as use of objects. Timirambak doshas causes mild blurriness of vision. संप्राप्ती संप्राप्ती घटक दोषास त्रिदोष दुष्य रस रक्त मांस अग्नि मंद्याग्नि leading to the arm formation. स्रोतस रूपोह स्रोतस सिराज mainly. स्रोतदृष्टी संघ विमार्गमन रोगमार्ग मध्यम ऍसिरा is प्रधान मर्म. अधिष्ठानी दृष्टी Drushti is general and Patal is particular. Sadhya Sadhyatva. Timar is early curable when the doshas are limited to first and second Patal. Yapya in third Patal. Asadhya when doshas are in fourth Patal. Surgical intervention for Kapha Linganash. Myopia. In modern definition of myopia, myopia is a short-sightedness, is a type of refractive error in which parallel rays of light coming from infinity are focused in front of retina when accommodation is at rest. Etiological classification: axial, curvature, positional index myopia due to excessive accommodation. Clinical classification: congenital, simple developmental, pathological, degenerative, acquired, post-traumatic, post-keratic, post-induced, pseudomyopia, space, night, and consecutive. Grading of myopia: low myopia, less than -3 degree, moderate myopia -3 to -6 degree, and high myopia is more than -6 degree. Clinical pictures, symptoms: poor vision for distant, that is short-sightedness, asthenopia, half shutting of eyes. Signs: prominent eyeball, anterior chamber is slightly deep, large pupil, temporal myopic crescent. Complication: retinal detachment, complicated cataract, vitreous and choroidal detachment. Aims and objectives: to know the incidence of myopia associated with poor sleep and screen time. Material and method: total 100 volunteer participants were selected for the present every studying the period of 2 months from OPD of Shalake Tantra, that is Nether Department, Sane Guruji Arogya Kendra Hadapsar Pune. Selection of volunteer: number of total participants were 100 participants were selected irrespective of their sex, religion, habitat. Okay, criteria. Criteria for inclusion: patients having signs and symptoms of myopia associated with poor sleep and screen time, including blurriness, difficulty to distant vision, visual hallucination. The patients of age 18 to 40 years, irrespective of gender. Patients who having a vision of 6'9" or less, that is 6'12", 6'18", 6'24", 6'36", 6'60. Exclusion criteria: known case of myopia associated with other ocular diseases such as retinal diseases, vitreal opacities, iridocyclitis, chorioretinitis. Patients having known case of HIV, HBsAg, malignancy. Study type: observational cross-sectional study. Study population: diagnosed patient of myopia. Sample size 100. Sampling technique, that is purposive sampling method. Method of measurements: objective parameter: visual acuity is measured by Snellen chart for distant vision. Study instruments is Snellen charts, autorefractometer, torch. Uh, Data management and analysis procedure: all data from OPD paper will be recorded in MS Excel and will be analyzed using appropriate statistical method. Data analysis and plan chi-square test will be applied to analyze the data. Observation and result. From above table, it can be observed that there is no significant correlation observed between screen time and various parameters, but there is significant correlation observed between sleep duration and autorefractometer readings. Discussion. The blue light emitted by lots of digital devices, which can decreases the production of melatonin, causes delayed in circadian rhythm of sleep at night, that resulting in delayed and poor sleep. Adequate sleep is important for learning, memory, attention, and general well-being. So it is important to limit the exposure to digital screen. This type of study will provide unique perception into biological and environmental factor underlying myopia, which will help in early diagnosis and treatment of myopia. According to Ayurveda, intake of apatyakar and achokshushya ahar vihar leads to increase in symptoms of diseases. Doshas travels to the siras to into patal, in turn causes dushti mandya, that is timir. Ayurveda describes many treatment modalities in the form of Patyakar Ahar Vihar, Kriyakalpa, Chakshusha, drugs, and Rasayan. According to modern medicine, myopia can be corrected by optical treatment like concave lenses, spectacles, contact lenses, or by refractive surgeries. These observational studies indicates there is no significant correlation observed between screen time and various parameters, but we can see the significant correlation observed between sleep duration at refractometer readings. Conclusion. This study has shown that there is no significant correlation, that is association observed between screen time and various parameters, and also there is significant correlation association observed between sleep time and sleep duration and at refractometer readings. Thank you.
Thank you, doctor. So next I invite Dr. Akshay for the paper presentation. I invite Dr. Akshay.
Yes, ma'am. Dr. Mahejaben is already sharing. Please stop the screen.
Dr. Akshay.
Yes, ma'am. Is it visible? Hello, ma'am. Is it visible?
No, doctor. No, doctor. It's started sharing now. Yeah, it's visible now. You can present.
Okay. Good evening, everyone. Myself, Dr. Akshay Bade, PG Scholar Final Year, Department of Rachna Sharir. I am presenting the topic Applied Anatomy of Pranva Srotasa with special reference to COVID pneumonia under the guidance of Dr. Vinod Chaudhary sir, Professor and HOD Department of Rachna Sharir, Shri Ayurved Mahavidyalaya, Nagpur. Introduction. Life starts with breath and ends with breathlessness. The maintenance of life throughout life is maintained by the pranva srotasa. Srotas is used as dynamic inner transport system of body, mind, spirit organization. In addition to circulatory system, srotas are the inner transport system of the body which provide platform for activities of other important biofactors like three dosha, seven dhatu, and ojan, the agni, etc. In Ayurvedic acharyas have described the entire range of life processes in health and disease depends upon the integrity of srotasa system, which is prone to lose its integrity due to the out of order lifestyle and faulty food. Life sustenance relies on maintenance of oxygen, that is ambara piyusha and water in the body. The world has been witnessing threats due to the different types of viral infections of respiratory system, like the recent coronavirus disease. COVID-19 pandemic, unfortunately, the conventional system of medicine has not come up with the successful strategy for the management of cases or for effective prevention. So our aims and objective to study the applied anatomy of Pranavas Srotasa with special reference to COVID pneumonia, to study the importance of Pranavas Srotasa and its anatomy. Pranavas Srotas is most important Srotas among all the Srotas because it carries Pran or Pranavayu, which is important for life. Places of Pranava, the stan of Prana is Murda or Shira Pradesh, Ura, Vakshasthal, place of heart and lungs, Kantha, Jiva, Nasika, and its function like spitting, sneezing, burning, Shwasa, respiration, intake of Ahar are functions of Pranavata. Here you can see the in picture left side are the left sides are associated with the inspirational pathway and right side for expirational pathway. Embryological appreciation of Pranavas Srotasa. Fupfusa develop from the blood flow, that is Rakta vein. Heart that bears the blood built from the blood and phlegm. Anatomical relations are from heart in the left lies the Fupfusa, that is left lung, and on the right phloem means right lung. Causes of Pranavas Srotasa vitiation, that is Dhatukshay means depletion of tissue. Sandarnata, withholding of natural urges. Rukshata, that is consumption of dry food. Or Shuddhitasya means excessive exercise during starvation, or Vayamata means strenuous exercise or excessive inappropriate exercise. Symptoms of Pranavas Srotasa vitiation: Atisrushtam Swasa, that is too long breathing. Atibaddham Swasa, that is obstructive breathing. Kupit Swasa means difficult breathing. Alpam Swasa means can stroke respiration, as you can see in can stroke respiration. Abhikshanam Swasam, that is frequent breathing. Sasabda Swas, breathing with abnormal sound. And Sashul Swas means painful breathing. Adhisthanam means site. The proper adhisthanam of COVID pneumonia can be suspected as costum itself, but the manifestation happens in Ura, which is itself is the predominant site of kapha. Many times it has been found that Pitta dosha exerts a significant pathological influence on kapha. The Ushna guna of Pitta in combination with Sasneha and Dravya guna will exert a pathological effect on kapha. Therefore, thereby making it as a asthira, means unstable and unbounded, that is abadha. Here also, as stated in the description of the stages, Pitta can trigger this pathological cascade leading to the Sandan and further Soshanam. This can lead to Dhatu Pakam and death, as we have seen in second wave of COVID-19. Samuttana Visheshanam, that is the etiology, the occurrence of the Kapha Vata predominant Sannipata Jwara as a Janapada Udvansa in Vasanta Ritu points to be rapid and violent vitiation of Vatu. Udaka Desa Kala, due to the activities that can be marked as Pradnaparad. Moreover, the predisposing factors such as the old age and comorbidities are the causes of the deteriorated Rogi bul and which resulted in instability of the ojas and fatality. Autopsy findings in China and European countries showed endothelial damage of pulmonary vasculature, microvasculature, thrombosis, and hemorrhage linked to extensive alveolar interstitial inflammation that ultimately result in COVID-19 vasculopathy, pulmonary intravascular coagulopathy, hypercoagulability, ventilation perfusion mismatch, and refractory acute respiratory distress syndrome. The predominant pulmonary involvement of COVID pneumonia can be explained by the commonality of Pranavas Srotasa vitiating factors with that of Vata. Shaya means weight loss, Veg Sandaran, that is constipation, Rukshata means low fat or high fiber diet intake, or Vayamata. Shuddhitasya, inappropriate excessive exercise. Clinical features: fever, fatigue, and dry coughing are considered the main clinical manifestations, but symptoms such as stuffy nose, running nose, and diarrhea are relatively less common. In severe cases, dyspnea and hypoxemia usually occurs after 1 week of disease onset, and the worst can repeatedly progresses to acute ARDS. Septic shock, metabolic acidosis, hard to correct, and hemorrhage and coagulation dysfunction, multi-organ failure, etc. We all know the preventive measures. So the treatment of Pranva Strotas, management of Pranva Strotas vitation is on the line of treatment of Shwasaroga, that is breathing disorders, Hridroga, heart disease, because the pulmonary circulation is involved, and CASA, cough. Methods of management, eliminative, that is mean those can be eliminated, and suppressive symptoms can be separated, palliative and reductive. Lung disease is suggested as Swasha Shita Ruksha Vadi. That means we require Ushna and Snigdha Chikitsa. Conclusion: the channels which carry the pranvayu, essential air, to be used for respiration are the pranva srotasa. Pranva srotas is considered to be respiratory system. The symptom associated with the pranva srota dushti also indicates involvement of respiratory system. So it is clear that pranva srotas are the channels of oxygen transportation from nasal cavity up to the thoracic cavity. It includes nasopharynx, larynx, trachea, bronchi, lungs, lung capillaries, and alveoli, along with the pulmonary circulation. Srotodushti of pranva srotas is experienced when excessively produced kapha obstruct the normal passage of vayu, which thus is excited and spreads in the whole lung, which manifests the symptoms of Shwasaroga. The predominant pulmonary involvement of COVID pneumonia can be explained by the commonality of pranva srotasa vitiating factors with that of vata and increasing incidence of these in the present day lifestyle. So these are the references. Thank you.
Thank you, Dr. Akshay.
Yeah, ma'am.
Next, we have a paper presentation. And before get start, let me remind you again, dear participants, please follow the time. Next, I would like to invite Dr. Akshada for the paper presentation. I invite Dr. Akshada.
Is screen visible?
Yes, doctor.
Okay. Good evening, respected judges, respected colleagues. Myself, Dr. Akshata, third year PG scholar from Department of Dravya Guna, STM College of Ayurveda, guided by Dr. Harini A, Associate Professor, Department of Dravya Guna, STM College of Ayurveda, Hassan. The topic of my presentation is critical review on Vardhamana Pippali Rasayana with special reference to Shwasahara Karma. Introduction. Respiratory diseases are nowadays one of the leading cause of morbidity worldwide. Implementation of Rasayana helps in prevention as well as cure of respiratory diseases. Vardhamana Pippali Rasayana is one among them. According to Ayurveda, Shwasa is a Kapha Pradhana Vata disorder affecting Pranavaha Srotas. Pippali, belonging to the family Piperaceae, is widely used as Deepana, Rasayana in Shwasa Kasa and Jwara Chikitsa. Review on Pippali, Pipa longum. In Charaka Samhita, Pippali is mentioned in the Shemani Mahakashayas like Deepaniya Mahakashaya, Kantya, Shula Prashamana, Kasahara, Hikka Nigrana Mahakashayas. Acharya Charaka restricted the excessive use of Pippali. So Chakrapani clarifies that restriction is limited only in case of diet and not for medicinal usage. In Sushruta Samhita, Pippali is told as Pitta Aviroti. Pippali in various Nigantus. In Bhava Prakasha Nigantu, Dhanvantari, Kayyadeva and Raja Nigantu says the common rasa as Katu rasa and the common guna told by all the Nigantukaras is Snigdha guna and the common virya, the peculiar virya is Anushna virya and Vipaka commonly told is Madhura Vipaka and Karma commonly told is Vata Kafahara and all of the Nigantukara says that it is indicated in Shwasa Kasa condition. Mode of action of Pippali on Shwasa. Katurasa of Pippali acts as Kafahara, Madhura Vipaka acts as Vata Shamaka. Since the Chikitsa Sutra of Shwasa goes like Yat Kinchit Kaphavatagnam Ushnam. Here, Pippali acts as Kafahara, Vatahara. So, Pippali can be used in Shwasa. Hence, it helps in Samprapti Vikatana of Shwasa. Method of administration of Vardhamana Pippali Charaka Chikitsa. In Pravara Roga of Pravara Bala of Rogi, Shrestha Matra is indicated. Pippali in the form of Kalka, Kwata or Shrita accordingly should be given. In Madhyama Bala of Rogi, Madhyama Matra is given. Pippali in the form of Kalka, Kwata or Shrita. In Avara Bala Rogi, Pippali is given in the Hina Matra. Pippali in the form of Kalka, Kwata or Shrita accordingly according to the Bala of the Rogi and palatability of the Rogi. Shrestha Prayoga of Vardhamana Pippali Rasayana. Here, total number of Pippali is 1000 and number of days is 19. Starting from the day 1 to day 10, Pippalis, starting from 10, it is given in the increasing order until day 10, until 100 Pippalis. And starting from the day 11 to day 19, Pippali is given in the decreasing order, starting with the 90 Pippali and ending with the 10 Pippalis. This is the Avara Prayoga of Vardhamana Pippali Rasayana. Total number of Pippali here is 1026 and number of days is 34. Here from day 1 to day 11, it is given in the increasing order, and from day 11 to day 90, it is given in order, ending up with the 3 number of Pippali. Various research works on Vardhamana Pippali Rasayana goes. First one is clinical study in the management of post-COVID syndrome with Vardhamana Pippali Rasayana and Pranayama. Result showed the significant result in the management of post-COVID syndrome. One more clinical research was on the evaluation of the effect of Vardhamana Pippali Rasayana in the management of hypothyroidism, a case study. Result was within a period of 3 months, the patient was completely devoid of the hypothyroidism symptoms as well as normal level of TSH, T3 and T4 was same. One more research work was on the clinical evaluation of Vardhamana Pippali Rasayana in the management of Amavatam. Intervention was here, the study was conducted on 73 patients having classical symptoms of Amavata, and the patients were given Vardhamana Pippali Rasayana for 15 days. Result was up to 50% relief from the Amavata and a significant decrease in the ESR was seen. Discussion. Respiratory diseases are nowadays become a global crisis. Rasayana plays a vital role in the prevention of the respiratory diseases. Vardhamana Pippali Rasayana is one among them. Pippali having Shwasa Kasahara property, Kapha Vatahara property, which helps in Samprapti Vikatana of Shwasa, the Kapha Pradhana Vata disorder. As COVID-19 cases has become global crisis and also clinical study of various Vardhamana Pippali Rasayana showed a significant result in post-COVID syndrome. So this Vardhamana Pippali Rasayana can be used as a preventive Rasayana in case of COVID-19 and other Shwasa conditions also. Thank you.
Thank you, Dr. Akshada.
Thank you.
Next, I invite Dr. Vinay Rajkumar Avale. I invite Dr. Vinay Rajkumar for the presentation.
Just a minute, ma'am. I will share a screen. Where is option? Box. Documents. Just a minute, ma'am. Okay. Good evening, all. My name is Dr. Vinaya Rajkumar Avle. I'm a student of Panchakarma Department, PG final year, from college LRP Ayurvedic Medical College, Islampur. So the topic of today's presentation is An Ayurvedic management of Grudrasi, a review. So, Grudrasi is considered in the Vatavyadhi. Vatavyadhi, Acharya told total 80 Vatavyadhis in Anatmaj Vyadhi. One of them is Grudrasi. Grudrasi is characterized by severe radiating pain starting from the low backache, that is kati, to gluteal region, to posterior aspect of thigh, to knee, to calf and dorsum of the foot, of the either side or one of the lower limb. This condition makes patients walk like a gridra, that is vulture gait. So Acharya named it as Grudrasi. This condition makes raising of affected leg or walking difficult. It hampers patients' day-to-day activity. That's why I chose this disease for the paper presentation. The definition of Gridrasi. Gridha is the dhatu from which the word Gridra came from to form a word Gridrasi. As the person walks in this disease like the bird Gridra, and his legs are rigid and slightly bended, curved while walking. It looks like the gait of Gridra, so this disease named as Gridrasi. As Acharya has mentioned, Gridrasi under Vatavyadhis, no any particular Nidan has been explained in the texts. So the Nidan mentioned which produces Vatavyadhi are considered as a Nidan for Gridrasi too. Besides this, Acharya Charak, Ashtanga Hridaya and Ashtanga Sangrahakar give specific cause of Vatavyadhi, that is Dhatukshaya and Avarana. There are two types of Gridrasi, Keval Vataj and Vatakafaj. Keval Vataj characterized by Ruk, Toda, Stamba, Spandana, Saktikshepana, Nigrahanti, Dehasyapi, Pravakrata. And Vatakafaj characterized by Tandra, Gaurava, Arochaka, Agnimandhya, Mukhapraseka, Bhaktadvesha, and Staimitya. Samprapti Ghataka, mainly involved dosha is Vata and Kapha. In Vata, mainly Apan and Vanavayu. Dusha, Rasa, Rakta, Mamsa, Asthi, Majja, Kandara, Sira, and Snayu. Jatharagni and Dhatvagni is involved. Jatharagni Mandyajanit and Dhatvagni Mandyajanit Grudrasi. Udbhavsthana Pakvashay, Adhishthana, Prusthakati, and speaker. Srotas affected are Rasavaha, Raktavaha, Mamsavaha, Medovaha, Asthivah, and Majjavah. Strotodushti is Sangha and Margavrodhajanya. Rogamarga is Madhyam. Vyakti Sthana is Speaker, Kati, Prishtha, Uru, Janu, Janga, and Pada. Two Bheda, Vataj and Vatakafaj. Swabhavi is Chirakari. Vyakta Rupa is Ruka, Toda, Stamba, Arochaka, Tandra, and Gaurav. Sadhya Sadhyatva of Grudrasi. Specific Sadhya Sadhyatva is not mentioned in text. So it may be said that Grudrasi in which the vitiated Vata is involved in Majja Dhatu, or Grudrasi gets involved with Anga Shosha, Stamba, or Kuddavat, it may be difficult to cure. On the other hand, if this condition occurs in strong person, healthy person, or and it is recent of origin without any associated disease, then this is curable. Acharya Sushruta has explained, included Vatavyadhi under Ashtam Hagada, which are considered to be Dushchikissa. Even though it is seen that if proper Vatashamak treatment, Nidan Parivarjana, Pathya given, then Gridrasi is curable in many patients. But it is also true, usually it is not Sukha Sadhya, it is Kashta Sadhya. Also, it seems Vata Kafaj Gridrasi is easily curable than that of pure Vataj Gridrasi. Chikitsa. Snehan. Snehan is used externally in the form of Abhyanga, Parisheka, Avagaha, etc. Sparshanendriya is the place of the Vata. So Snehan done on skin is always elevates Vata. Svedana. For Shula Prashaman, and Vata Shaman, Svedan is given. Snigdha Sveda is preferred in Gridhrasi. Under Shodhan, we can give Mrudu Virechan, Basti Karma. Agni Karma is also given in the text for the treatment of Gridhrasi. In Shaman Chikitsa, we can give Vata Shamak treatment like Yograj Gogul, Trifala Gogul, and Rasna Saptak Kashay. In Pathya Pathya, आहार पथ्य आहार लघुसुपाच्य वातानुलोमक आहार प्रिस्क्राइब शिगरू ब्रिंजिल मेथी जीरक हिंगू सैंधव युष मांसरस etc prescribed in pathya and in vihar sitting in correct sitting posture avoid lifting heavy objects regular yogasana abhyanga hot water bath bowel and bladder adjust should be attended timely. In apatya ahar vatavardhak ahar bakery products pulses peas wafers maida products cold drinks spicy food should be avoided. In vihar excessive physical work exercise uncomfortable sitting postures and cold exposure should be avoided. Gridhrasi affects the locomotor system of body. Routine lifting of heavy objects, daily exposure to whole body vibrations, sedentary lifestyle, wrong sitting posture worsens the disease condition. Accepting daily healthy habits can minimally relieve pain. Besides this, taking Ayurvedic treatment like Basti, Mruduvirechan, Agni Karma, regular yoga asana, healthy meals, Vatashamak medications, and Vatashamak ahar can improve condition to maximum extent. In modern treatment, painkillers, physiotherapy, steroids, epidural steroids, injections, surgical interventions has its own limitations. So preferring Ayurvedic treatment over modern is always the best option in Vatavyadhis, like Gridhrasi. Conclusion, as we can see nowadays, people with sedentary lifestyle choosing junk food over healthy food, excessive strenuous work, exhausting works, excessive traveling, sitting in uneasy posture for longer time causes Vata Prakop, which leads to Vatavyadhis like Gridhrasi. Opting temporary relief with painkillers, local application, injectable does not give satisfactory results. Rather, choosing Ayurvedic treatment would be always the best thing for getting rid of disease to maximum extent or destroy them. With help of Shodhan treatment like Basti, Virechan, Agni Karma, one can get surely maximum relief. Thank you. Hello.
Thank you, doctor.
Thank you.
Next, I would like to invite Dr. Shekhar Dattatreya for paper and poster presentation. Hello, Dr. Shekhar. Dr. Shekhar. Next, we have a paper presentation. I invite Dr. Amar Madan Shinde.
Hello.
Hello, doctor.
Hello.
You're audible, doctor.
1 second, ma'am. Myself, Dr. Amar Madan Shinde, from CSMSS College, Aurangabad. My topic is role of Agni Karma in the management of Vatakandaka, with special reference to calcaneal spur. Introduction. Ayurveda is the science which deals with the various principles and treatment modalities which helps to cure the disease. The main aim of Ayurveda is prevention is better than cure. That is prevention as well as cure for the disease. In Shalya Tantra is one among the Ashtanga Ayurveda, which deals with the various disorders related with the surgical procedures in various diseases. Introduction. Introduction of Vatakandaka. Vatakandaka is the one of the common and major problem in today's era. It can be correlated with the calcaneal spur in modern science. Calcaneal spur, it is the presenting with painful heel, which is highly prevalent clinical conditions. Acharya Sushruta mentioned Vatakantak under Vatvyadhi, in which develops due to the excessive exertion and walking on the uneven surface, which leads to severe pain in the foot region. There are several interventions for calcaneal spur, which includes surgical, excision, or extracorporeal shock wave therapies. About Agni Karma, in Ayurveda, Agni Karma mentioned among the Anushastra Karma. It is indicated the various diseases related with Shira, Snayu, Asti, and Sandhi. Vatakantaka is one of the Vatavadi which forms due to vitiation of dosha. Nidan of Vatakantaka, Visham Stan Gaman, walking in uneven surface, excessive exertions. Samprapti of Vatakantaka, Nidan Sevan, Vata Prokop, Khavai Gunya, Stan Sanchray, Parshni and Gulfa Pradeshaha, Vaddosha further vitiated Asti Dhatu, Asti Vikruti at Parshna Pradeshi, Ruko Utpatti, Parshna Pradeshi, several pricking pain and at Parshni Pradeshaha. That is Vatakanta. Agni Karma procedure. Purva Karma, proper clinical diagnosis, written informed consent, necessary laboratory investigations. Pradhan Karma, patient is made to lie in comfortable position. Then the red hot panchakol shalakas applied to the most tender part of the Parshni Pradeshaha with the bindu type of Agni Akruti. Precaution are taken or any asamyak of Agnidagdha. Pashat Karma, after the completion of Agni Karma procedure, it dress up with application of Shatadhod Ghruta for Puranadagdha Karma. Mode of action. In modern science, the pain inhibiting system having gate control system, which includes pain signals to the brain. It stimulates the lateral spinothalamic tract, which further inhibits the blockage of pain sensation. Thus, Agni Karma is effective in Vatakantak. Conclusion: Agni Karma is very effective in the management of Vatakantak. Agni Karma helps provide relief in the heel pain and avoid recurrence of the calcaneal spur. It is one of the safe, chief, comfortable procedure. Agni Karma can be performed accordingly to various chronic disorder and stages. Thus, Agni Karma is very useful for the pain management in Vatakantak. References. Thank you.
Thank you, Dr. Aman.
Yes, ma'am.
Next, I invite Dr. Vani Panchamukhi for the paper presentation.
Hello, Dr. Aishwarya. Can you hear me?
Yes, doctor.
Yeah, give me a minute. I'll please start the screen sharing. Can you see the screen?
Yes, doctor. Please start.
Yeah, give me a minute. So, hello everybody. Good evening. I'm Dr. Vani Panchamukhi from Ramakrishna Ayurvedic College, Bengaluru. I'm doing third year Panchakarma PG in the college. And today I'm presenting the topic mode of action of Basti. Even though Basti is considered the Ardha Chikitsa in Ayurveda and in Panchakarma, but no clear-cut explanation can be given regarding the mechanism of action of drugs administered in the form of basti. Even though an assumption is made to substantiate the probable mode of action of basti in collaboration of classics views as well as the modern pharmacokinetics. Acharya Charaka said, as the Bhaskara, that is the sun, pulls out the Bhusara, that is the moisture, from the earth. I'm sorry, give me a minute. Yeah. I'm really sorry. Acharya Charaka said that as the Bhaskara, that is the sun, pulls out the Bhusara, moisture, from the earth, Basti pulls out the doshas from Apadatala Urdhvasthana, that is from sole to foot, from sole of foot to head, and brings to Pakvashaya. Acharya Sushruta said, as the moisture absorbed by the roots spread to all the parts of the plant, the virya of medicine given through basti spreads to all the parts of the body. Acharya Vagbhata suggested that as a cloth immersed in colored water takes the color and leaves water, basti takes doshas from deha. Various views have been seen in the modern aspect also, which have tried to understand the concept of how the basti works. Let me just try to summarize a few. One is by the absorption of the bacterial flora. Dr. C. Dwarkanath, in his book on the fundamental of principles of Ayurveda Panchakarma, suggested that basti, by virtue of its medicaments, greatly influences normal bacterial flora, which modulates the rate of endogenous synthesis of B12, which has a role to play in the maintenance and regeneration of the nerves. One of the possible mechanisms through which basti could help in Vatic disorders. However, this hypothesis is yet to be tested in the scientific parameters. Absorption by osmotic pressure is also a concept by which we think that the mode of action of basti can be compared to. The osmotic pressure causes a release of catecholamines during visceral distension. It can be hypothetically explained that as the aushatas are hypertonic solution, after entering the large intestines, the fluid may be transferred because of osmosis from hypotonic to hypertonic solutions. That is, fluid along with tonic materials are dragged from intercellular and extracellular level into the large intestine and throughout from the body. One of the very famous concept of the action or mode of action of basti is by the enteric nervous system. The enteric nervous system, that is the ENS, is a subdivision of the peripheral nervous system that directly controls the gastrointestinal system. ENS has been described as a second brain as it can operate autonomously. It normally communicates with the CNS through the parasympathetic nerves and sympathetic nerves through the nervous systems. The sensory nerves reports on mechanical and chemical conditions. Through intestinal muscles, the motor neurons control peristalsis and churning of the intestinal contents. Other neurons control the secretion of the enzymes. ENS contains supporting cells which are similar to astrologia of the brain and a diffusion barrier around the capillaries surrounding ganglia, which is similar to the blood-brain barrier of the cerebral blood vessels. So, enteric nervous system, or the gut brain as it is known as, is an integrative system with structural and functional properties and are similar to those in central nervous system. System and physiological and pharmacological properties of Basti Chikitsa are said to be the outcome of modification of the gut brain up to some extent. We can conclude, as many modes of actions of Basti have been explained by Acharyas, and the recent researchers like enteric nervous system, osmosis, gut brain, or the bacterial floral action. We can summarize as Basti is the Pradhana Chikitsa for Vata, and Vata being responsible for dosha spreading to the other sthanas, Hence, by doing Vata Nigraha, Basti directly or indirectly corrects all the other doshas. Thank you.
Thank you, Dr. Vani. Next, I would like to invite Dr. Minal for the paper presentation.
Hello, ma'am.
Hello, doctor.
Hello,
Yes,
ma'am.
you're audible, doctor.
Yes, ma'am.
Hi, doctor. I am Dr. Shekhar. Can I share my PPT?
No, doctor, please wait. Now there is another participant is trying to present.
Yes, ma'am. No problem. He can. I want some time.
Okay, doctor. Dr. Shekhar, please share.
Okay, man. Thanks.
Someone is raising their hand. May I know what can I do for you? Hello, doctor. Hello, Dr. Shekhar. Hello, Dr. Shekhar. Dr. Shekhar, can you hear me?
Just a minute, man.
Hello, Dr. Shekhar. Hello, Dr. Shekhar. Can you hear me?
5 minutes, ma'am. 5 minutes. 5 minutes.
Doctor, if so, then you can present next. Dr. Shekhar, you can present next. Dr. Minal, are you ready to present?
Hello, ma'am. I'm Meenal.
Can you present now?
Ma'am, actually my PPT is not going sharing on the screen, so that's why.
Okay, doctor, no problem. Then I invite Dr. Rucha for presenting the poster on the topic Dektavaha Srodhas.
Hello, ma'am. Yes. Hello.
Yes, you are audible, doctor.
Yes. Screen is not sharing, I think. Hello. Hello.
Hello, doctor. Please start.
Hello, ma'am. There is a problem to share. Someone is there. It is written you cannot start screen share while the other participant is sharing.
Dr. Shekhar. Whoever sharing the screen, I request you to stop this.
Yeah, it is.
Dr. Rucha.
Yeah. Yeah. Yeah, it is visible.
Yeah, it's sharing, doctor. Yeah, it's visible now.
Good evening, all. I am presenting a. I am Dr. Rucha Bendodekar, final year PG scholar from PMT Ayurved College, from Kajakisa department, and my guide is Dr. Sandeep Suse, professor of Kajakisa department. Here I am presenting a poster of Raktavah Srotas. The Moolasthana of Raktavah Srotas are, according to Charak, it is Yakrit and Pliha. And then according to Sushruth, he added a Raktavahini Dhamanis also. Then the Dushti Hetus of Raktavah Srotas. These are Vidahi Annapan. The Vidahi word meaning which is increasing a heat in body, or it is causing a daha in body. So here are some examples like soups, like Chinese soups will be there, or cold drinks that causing a heat inside the body. Then the other
examples are there. Then snigdha, ushna, drava. Snigdha, that is oily food is there, and ushna drava is again increasing the heat. Food that is increasing heat, or the drinks that is increasing the heat in the body. Then atapa and anila. So the workers which are working in the sunlight or like that, or near the furnace, they are the causing hetus for the dushti, hetus for the raktava srotas. Then the dushti lakshanas here mentioned, the diseases. These are the pictures showing here. Kushtha, types of all kushtas can be seen in the raktava srotas dushti. Then visarpa, pidaka, then raktapitta, gulma, vyanga, then nilika, then piplava, vidradhi, tilakalaka, raktapradara also there, and raktamandalas can be seen. Kotha, pama, shvitra, then charmadala, dadru, mukhapaka, gudapaka, medrapaka, kamala, and pliharo. So the disease of pliha can be seen in this raktavasrotas dushti lakshanas. Then raktavasrotas dushti chikitsa included 4 things, that is raktapitta hara chikitsa separately, then virechana, upavasa. Upavasa is a fasting to the patient, that is langhana can be given, and raktamokshan by means of the jalauka acharan or other methods of raktamokshan can be applied. Then raktapitta hara chikitsa is mentioned here in detail. So raktapitta chikitsa sutra is we have to analyze some bala of the patient. That is, if the patient is balavana, then stambhan cannot be done in the case of raktapitta. And if it is durbala, then stambhan should be done. And in balavana patient, samshodhana and langan should be done. And here durbala do not do the samshodhana and langana. Then patya in raktapitta, if the patient is balvana and the raktapitta is urdhvagata, then do the, if the kafanubandha is there, then do langhana. And in adhogata raktapitta, if vatanubandha is there, then do tarpana. And if no kafanubandha is there, then in urdhvagata raktapitta do tarpana. And in adhogata raktapitta, no vatanubandha is there, then give peya. So what type of tarpana and peya should be given? Here are the list of that. खजुरादी तर्पण, लाजा तर्पण, शाली, मुद्ग यूष, मसूर यूष, चणक यूष, शाक यूष, मांसरस, and riberadi peya. Then this is the patyapatya of the raktapitta. Then come to the next samshodhana. So in samshodhana, if the balwan patient is there, then only the samshodhana can be done. So in balwan patient, if udvaga raktapitta is there, then do the virechana, and after virechana samsajan kram is there, then do the tarpana. In adhogata raktapitta, if there is a adhogata raktapitta, then do the vamana, and after vamana samsajan come with yavagu. Then the samshamana chikitsa, after samshadan samshamana. So samshamana can be done with the atarushakadikvat, padmakadikvat, ushiradi churna, kiratatikta churna, ushiradi peya, priyangvadi peya, vasa gruta, and shatavaryadi gruta. Thank you.
Thank you, Dr. Rucha. And before going to the next presentation, dear participants, I'm repeating, other than the presentator, please don't share your PPTs without informing us. And next, I invite Dr. Shekhar for the presentation. Dr. Shekhar. Next, I invite Dr. Minal for the presentation.
Yes, ma'am. Yes. Ma'am, someone is sharing, I think so.
Dr. Rucha, please stop the sharing.
Yeah.
Dr. Minal?
Yes, ma'am. Yes. Ma'am, again problem in sharing the screen.
Okay, doctor, you can try next.
Okay,
So, Dr. Shekhar, are you there? Dr. Shekhar, can you hear me? So next I invite Dr. Dinesh. I invite Dr. Dinesh for the paper presentation. Dr. Dinesh. Next, I invite Dr. Gunwan for the paper presentation.
Yes,
I
ma'am.
invite Dr. Gunwan.
Yes, ma'am. Thank you. Madam, is it visible? My screen is visible?
Yes, your screen is visible, doctor.
Thank you. A very good evening to all. My name is Dr. Gunwant Tekade.
Doctor, your screen is your screen is visible, not your presentation.
Now?
No, doctor. Please open the folder.
Now, ma'am?
No, doctor. Please try to open that PDF, doctor.
It is already open. It is visible on my screen.
Oh, no, doctor. It's only visible your system screen only.
System screen. Again, I have to start. Now?
Yeah, it's visible now, doctor.
Thank you. Good evening. My name is Dr. Gunwant Tekade. I am MD final year student of Sastrutya and Yoga in Bhausaheb Mulag Ayurvedic Mahavidyalaya, Nagpur. And today topic of my presentation is Rasayan therapy with relevance in modern era. What is Rasayana? Rasayana is the science of nutrition, aiming to procure the best qualities of body tissues, leading in turn to longevity, immunity resistance against disease, improved mental faculties, ideal social environment. Rasayan therapy, it is described by all the classics of Ayurveda on priority. Rasayana is one of the 8 branches of Ayurveda, Ashtanga Ayurveda, and it includes regenerative lifestyles, healthy dietetics, use of regenerative herbomineral nutraceuticals. Rasayana stands as an answer to solve the problem of helpful longevity, including mental and developmental resistance against the disease. Sushruta defines Rasayana as a measure which prevents aging, prolongs longevity, develops positive health, improves mental faculties, and provides resistance and immunity against the disease. It is a specified type of treatment influencing the fundamental aspects of the body with dhatus, agni, metabolic activity that is, and strotasi, that is microcirculation, and helps in the prevention of aging. The possible mechanism of actions of Rasayanas could be nourishes and maintains the cell life, that is nutraceutical action, encourages the growth of new cells, that is regenerative action, prevents recurrent infection, expelling the damaged cells, that is immunomodulatory action, eliminates the toxic metabolites and pollutants, that is the antioxidant action. Who can use Rasayanas? Ideally, use of Rasayanas should be started before onset of old age. But one can start the practice of same at any age. For maximum benefits of same, bioverification of body should be achieved. Selective Rasayana can be used for selective benefits. People desirous of achieving of highest physical and mental health should use Rasayana. Classification of Rasayanas. As per the scope of use, it is classified as Kamya Rasayana, then Naimantik Rasayana. Kamya Rasayana, it is divided into 3 parts, that is Pran Kamya, Medya Kamya, and Shri Kamya. And Naimantik Rasayanas, and the second part, classification is as per the method of use, Vatatapik, that is outdoor, and Kuti Pravashik, that is intensive regimen, that is indoor regimen. As per the contents, it is divided as Achar Rasayana, Ajastrika Rasayana, and Aushadhi Rasayana. What are the possible attributes? Antioxidant effects, that is vitamin C, tocopherol, retinol, selamine, lycopene. Anti-aging effect, that is ashwagandha, Indian ginseng, and turmeric. Immuno enhancer, psychoneurostability, anti-stress effect, anti-cancer effect, and adaptogenic effect. Medya Rasayana, the drugs are known to act as medicinal neuronutrients and promote memory intelligence and retard the mental aging. The prominent Medya Rasayanas are Brahmi Rasayana, Mandukparani, Ashwagandha, and Jyotishmati. Rasayana are also used as a drugs. For example, Shilajit is used in Madhumeha and turmeric oil is used in leprosy. Specific evidence-based action of specific Rasayanas. Amla fruit, it is used as antioxidants. Haritaki fruit, it is also used as antioxidants. Ashwagandha, it is adaptogenic. Guruchi, it is immunomodulatory. Shilajit, it is anti-diabetic. Bhallatak, it is anti-cancer. Mandukparani, Brahmi is immune booster. And Chyawanprash as anti-aging and immunoglobulin. Rasayan drugs for specific use. For Rasadhatu, Khajura and Draksha. For Raktadhatu, Loha, Amalaki, Bhringaraj and Palandu. For Mansadhatu, it is Bala and Ashwagandha, Nagbala. For Medadhatu, Guggulu, Shilajatu, Amrita and Haritaki. For Astidhatu, Laksha, Shukti and Shankha. For Majjadhatu, Loha and Vasa. For Shukradhatu, Ashwagandha, Kapikachu and Shatavari. Results and conclusion. Ayurvedic Rasayana are playing a very vital role in modern lifestyle disorders. In COVID-19, Ayurvedic Rasayana are found to be very much effective as an immunity booster. Rasayana have a very significant role in preventing disorders related to sedentary lifestyle, improper food habits. It forms a comprehensive package of healing, preventing, and maintenance of health. In current scenario, use of Rasayana, especially in early and middle age, according to may help in minimizing the preventing lifestyle disorders. Thank you for your kind attention. Have a great day. Thank you.
Thank you, Dr. Gunwant. Next, I invite Dr. Manisha Aswale. for presenting the paper. I invite Dr. Manisha.
Okay, ma'am. I will share. Is it visible, ma'am? Is it visible, ma'am?
Yes, it is visible, ma'am.
Okay, I will start. Good evening, everyone. I am Dr. Manisha Aswale. Topic of my presentation is Concept of Garavisha in Ayurveda, a literary review. Guided by Dr. Urade sir, HOD and Professor, Department of Agat Tantra एवं विधि वैद्य, भाऊसाहेब मुळक आयुर्वेद महाविद्यालय नागपूर. These are the contents of my presentation. Visha is the substance which immediately after entering into the body causes the vitiation of the healthy dhatu or killing of the sorry sir, 8 minutes. Visha is the substance which immediate after entering into the body causing the vitiation of the healthy dhatu or killing of the healthy person in defined as Visha. Visha causes sadness to the world. In Ayurveda, the Gara Visha is considered as one of the form of Kritrim Visha, which is get formed by the combination of two or more than two poisonous or non-poisonous drugs. Aims and objectives are to study the concept of Garavisha according to Ayurveda, collect and arrange all scattered references according to Ayurveda Samhita. Literary review. According to Acharya Charaka, Gara is the toxic combination of poisonous or non-poisonous substances and which exert toxic effect after interval of some time, and as such does not kill the patient instantly. And Acharya Sushruta said, the pulverized bodies of insects poisoning as they do the characteristic features of the Dushivisha or inflammable poison is turned into Gara or chemical poison if administered internally with any medicine or externally with any leaf or plaster. What Vagbhata said, the combination of part of the body and excreta of the different animal, incompatible drugs, ash, and poisonous substances of mild potency is known as Garavisha. Bhav Prakasha classified the Kritrima Visha in different manner. The Kritrima Visha is one which is prepared by the non-poisonous substance called as Garavisha, and another which is prepared by the poisonous substance is called as Dushivisha. Similar definition explained by the other acharyas also, like Yoga Ratnakara in Madhav Nidana and Sharandar Samhita and Chakrapani. The clinical features of the Garavisha is the person become pale, emaciated, poor digestion, flatulence, palpitation of heart, edema in hand and feet, abdominal distension, Grahani disorder, tuberculosis, fever, etc. Features seen in dreams, mostly seen cat, CR, mongoose, monkey, etc. animal. Dried river and trees. In a dream, having lost his senses, he sees himself in fair complexion, though actually being a dark complexion, devoid of ears or nose. However, those conceptions cannot be accepted in the current days. And Yoga Ratnakara explained that the Garavisha consumption shows its impact on the body after 15 days to a 1 month of the duration. Food incompatibility. There are 18 types of food incompatibility described in the Charak Samhita. According to Acharya Vagbhata, Viruddha Ahar act as a Garavisha. Some examples are milk and jackfruit, Samata Viruddha, milk and horse gram, Vishamta Viruddha, milk and fish is Vishama Sama Viruddha, milk and citrus fruits, that is Sanyoga Viruddha, like a custard and milkshake. Eating sattu in night is Kala Viruddha. Honey plus ghee is Matra Viruddha, and alcohol with sweet, cola with pizza, and sizzler ice cream are the examples. Treatment according to Acharya Charaka, first is Shodhana, emetic therapy, that is Vamana. Then should be administered fine powder of copper, that is Tamra Bhasma, with honey for the cleaning the heart. Then Himaprashana or Swarna Prashana, Suvarna Bhasma with honey. Naga Dantadi Ghrita, that is the Agatapana. According to Bhagavata, Vamana, then Dieta, then Suvarna Yoga. Suvarna Makshika or the Suvarna Bhasma with sugar and honey. Treatment of the Mandagni, the powder of Murva, Amruta, Tagara, Pipali, Patola, Chavya, Chitraka, Vacha, Musta, Vidanga, mixed with either buttermilk, warm water, water of the curd should be consumed. Treatment in the damaged skin, apply lepa of the Renuka, Chandana, Priyangu, khas on skin. Milk and ghee is the supposed to be the base diet in the Garavisha. Discussion and conclusion are: Garavisha is the significant role in causing toxic symptoms due to its various uses of the Viruddha Ahara in present society. Nowadays, children and youngsters are getting attracted towards the fast food, which is one of the causative factors of the Garavishaktata. So, Ayurveda offers effective management on it. These are the references, and thank you everyone.
Thank you, Doctor. Next, I would like to invite Dr. Kalyani for the paper presentation on the topic Ayurvedic rejuvenation therapy and disease prevention. Dr. Kalyani, are you there? Hello, Dr. Kalyani, are you there? Okay, next I would like to invite Dr. Karbari Santosh for the paper presentation on the topic role of Agnikarma in the management of Vatakandaka. Dr. Karbari, are you there?
Yes, sir. I'm audible.
Audible, Doctor, audible. Your screen is also visible, Doctor. Please start the session.
Hello.
Okay, sir. Hello.
Please continue,
Hello.
Doctor.
Okay. Role of Agnikarma in the management.
Doctor, your screen is now
audible?
not visible. Please once again, please share, Doctor.
Okay, sir. Now, sir.
Now visible, Doctor. Please start the session.
Okay. Good evening, everyone. Myself, Dr. Karbari Santosh, TV scholar, KVJ Ayurveda Medical College and Hospital, Sweden. My topic is role of Agnikarma in the management of Vatakandaka. The introduction: Vatakandaka is the disease of Vatavadi. It has the prime symptoms of the pain in heel region, which is interface with the free locomotion of the individual, resulting in the hindrance to his daily activity. It can be correlated with the plantar fasciitis and calcaneus spur, which is a very common cause of heel pain. As per Harrison, It has a peak incidence between the 40 to 60 years of the age. It accounts 70% of the total case of the painful healing. Acharya Sushruta, Vagbhata, Yoga Ratnakara, Chakravarta, Vangasena, and the Madhokara have narrated this disease under the Vata Vedic context. The Nidanas goes like this. Walking in uneven surfaces like high heel footwear, hard footwear, improper fitting footwear, and standing for the prolonged time, and excessive walking, and Vata Vruddhi Nidanas. The Samprapti goes like this. Nidana, Abhigata, inflammation, then Raktavruta Vata Prakopa, then pain in the heel. Chikitsa, Samanya and the Vishesha Chikitsa. Samanya Chikitsa like Vata Vyadi Chikitsa, Snehana, Vedana and Basti. And Vishesha Chikitsa, Rattamokshana, Agni Karma, Erenda Tailapana, Dahana with Suchi, Ruksha Svedas like Valuka Sveda and the Ishtika Sveda. Agni Karma, Agnina Krutva Ya Karma. It is one among the parasurgical procedures in which heat is transferred to body by various dravyas. Nowadays, Agni Karma is modified as electric cauterization, which is used for the various minor and as well as major surgeries. The detailed description found in the Sushruta Samhita. Agni Karma is superior to Kshara Karma, Shastra Karma, and the Deshaja Chikitsa because of its Punarbhavatvam of the disease treated with the Agni Karma. The instrument used for Agni Karma, Pipali, Ajas, Shakrit, Godanti, Shara, Shalaka, Shaudra, Guda, Neha, etc. Among these, Shalaka made of Pancha Loha is most commonly employed. The procedure like Acharya Sushruta has mentioned the four kind of applications, Agni Karma. They are Valaya Bindu Vileki and Pratisarana. The Purva Karma of this procedure is affected part should be clean, and Pradhana Karma Shalaka is made red hot and applied over the area of pain till Samek Dagda Lakshana are attained. Then Paschat Karma, application of the Shita Virya Dravya over the area of the Agni Karma. Then Samek Dagda Lakshanas like burn, which is superficial, having a color of Kala Rose. The mode of action of Agni Karma, Vatakandaka is mainly caused due to Visheshana of Vata Dosha with Anubandha of Kapha Dosha. Vata is responsible for pain and stiffness, and the Kapha Dosha is responsible for the swelling in the heel. The Agni Karma considered as the best therapy to pacify these dosha. The transferred physical heat from red hot Shalaka to Vak Dhatu and its act in three ways. That is, it removes the Soto Avarodha and pacify Vishesh with Vata and the Kapha Dosha and maintain the equilibrium. It also increases blood circulation to affected site, increases blood circulation to the site by the vasodilation, flushes away the pain. Therapeutic heat reaches deeper tissues and neutralizes the Shita Guna of Vata and the Kapha Dosha. Thus, Agni Karma reduces pain, swelling, stiffness, and may found beneficial in the management of Vata Kantaka. The biochemistry of Agni Karma. In all life forms, there found a group of a gene called the heat shock gene. When heat shock occurs, these genes are stimulated, releasing the group of protein, which triggers the immunological system. Thus, the reduces the inflammatory process. The discussion Vata Kantaka disease manifested when Vata takes shelter in the ankle region and causes the severe pain. The Agni Karma requires minimum equipment, and it is considered as non-infectious procedure that offers a great relief from pain and associated with the Vata Kantaka. The chance of recurrence are minimal after performing Agni Karma. However, some precautions must be taken before and while performing the procedure. If not, it will lead to complication. The conclusion, as a pain in healed region is most bothering complaint in Vata Kantaka, and Agni Karma may prove beneficial in reducing the symptoms. Thank you.
Thank you, Doctor. Next, I would like to invite Dr. Vidya Sambhaji Jadhav for the paper presentation on the topic Sthanika Chikitsa in Prasuti Tantra and Sri Yoga. Dr. Vidya, are you there? Dr. Vidya, are you there?
Yes, sir.
Okay, Doctor. I will share for you, Doctor.
Yes, sir.
Sorry for the delay.
Yes, sir.
Doctor, is the screen is visible?
Yes, sir.
Okay, Doctor. Please start the session, Doctor.
Good evening, everyone. I, Dr. Vidya Jadhav. Today we are discuss about Sthanik Chikitsa in Prasuti and Sri Rog. Introduction. In Prasuti Sri Rog, Sthanik Chikitsa yogas are indicated, but no proper explanation of the procedure mentioned. Chikitsa Sarvadaik and Sthanik. Sarvadaik plus Sthanik for the successful management for many gynecological diseases. इन वात जेवणी व्यापक चिकित्सा कर्मभि व मनद्दैश्च मृत्युभि योजित स्त्रिया सर्वतः सुविशुद्ध्याः शेष कर्म विधीयते बस्ति अभ्यंग परिषेक प्रलेप पिचु धारणः इन पित्त जेवणी व्यापत पित्त लाणं तु योनिनां सेक अभ्यंग पिचु क्रिया शीताः पित्त जिताः कार्य स्नेहार्थ घृतानि च मोड ऑफ एक्शन ऑफ स्थानिक चिकित्सा Sthanik Chikitsa as important as Sarvadaik Chikitsa. In local route of drug administration, high concentration of drug is expected to act as at the target organ than internal medication, faster and efficient action. स्थानिक चिकित्सा क्षालन पिचू वर्ती धूपणलेप अभ्यंग पूर्ण अवगाह उत्तर बसती Purva karma, preparation of the OT, preparation of the patient and preparation of the medicine. Yoni dhavan, synonyms yoni kshalan, yoni prakshalan, yoni parishekam, cleaning or washing the vagina with medicated decoction, stand external genitalia and vagina. Procedure, kshalan with lukewarm a decoction filled in douche can attach with tube and nozzle in continuous manner at a constant pressure. Triphala kashak shalan, kapha har srav har ropan. Benefits: washes out the discharge of vagina, and the action is mainly by the drugs used for preparation of the medical decoction, normalize vaginal pH, thereby prevents the pathogenic microbes, makes yoni favorable for conception, exfoliation of cells, and promote the ropan. Stana parishekam. Indications: stanashop, stanavrana. Pichu dharan, pichu means carpa stula, common type. Tail pichu, shape used circular and elongated. Procedure: pradhan karma, purva karma, panchat karma. Pradhan karma, aseptic sterile pichu soak in lukewarm tail, gruth or kasha inserted into the vagina. The thread of the pichu should come out of the vagina for easy removal. मधुर औषधी सिद्ध तैल पिचू वात विजयनार्थ पवणेन अनक्रांत यवनी सुकम गर्भसूते टू सॉफ्टन दी वजाइनल कैनल कषाय रस सिद्ध कषाय क्वाथम इन यूज इन रक्त प्रदर यूज फॉर स्तंभन एज ए रक्त जीवन Contraception, subdermal vaginal canal supports easy delivery, व्रणरोपण, यौनी विशोधन, रक्तस्राव स्तंभन, अपत्यकर. Benefits: medicine retained for longer time, helps in proper absorption and action, performs action with the help of drugs used in preparation. Mutra sangha, contraindications: mutra sangha, यौनी शोथ and यौनी शूल. वर्ती वर्ती रिव स्वरूपतः वर्ती नामना प्रकीर्तितः टाइप ऑफ फलवर्ती डायमीटर 1 अंगुली वर्ती तीक्ष्ण शोधन लेखन उष्ण प्रोसीजर पूर्व प्रधान कर्म पश्चात कर्म प्रधान कर्म वर्ती inserted to the vagina पश्चात कर्म क्षालन with सुकांबू indications cervical erosion. Benefits: local action by direct mucosal absorption, action depends on drugs used, helps in combating various infections and diseases of yoni. Hygroscopic helps absorption of srav. Exfoliation of cells helps inducing menstruation. Lepakarma synonyms lip lepan alepa external application until the lip dries. Procedure freshly prepared lip applied evenly and uniformly on the affected areas. The lip remove immediately just before drying. Sukambu parishekam if required. Allergic reaction on the skin, rashes, burning, cracks, irritation of the skin, etc. Alep in sthana vidradhi, pain management, reduce inflammation. Yoni dupan, fumigation of vagina with medicated smoke, site of yoni dupan bahya yoni, maximum of 15 minutes or depends on patient. Procedure, a chair having hole in the middle is used. The dupan drave are in dupan apparatus which is placed just below the chair. Patient asked to sit in this chair after avoiding urine covered with the cloth. The smoke coming from the dupan drugs must reach up to the expected genitalia for fumigation. Temperature rise may cause the danger of burns of the genital organs from the fumes of the smoke. Kushta gugulu agru with growth in sutika. Yoni abhyanga. Pittalanam tu yoninam sek abhyanga. Increase the perineal muscles tone and strength. Procedure lithotomy position. 5 cc syringe filled with lukewarm tail inserted into the vagina with a sterile rubber catheter. Glow finger inserted into the vagina. Abhyanga done on the vaginal wall. Patient lie for 15 minutes. Gauze pad to avoid the spillage of oil. 15 to 20 minutes duration. Til tel yoni abhyanga for uterine prolapse. It helps Mardokar, Mouse Therekar, Balakar, Vathar, and Shetilhar. Yoni Purana. Filling the cavity of vagina completely with oils, paste, powder, Veshwar. Pinda. Insertion of medical boiled drugs in the form of circular paste wrapped in disinfected cloth into the vagina. Commonly used is Kalk, done when retention of large quantity of drug is required to be retained at the site of action. Procedure. Dorsal position with knee flex. Application of Purandrave inside the vagina with a sterile glow, warm hand and arch for micturition if needed. So Kambushal and difficulty in removal of Kalk. Benefits. Mechanical support. रक्तस्तंभन, पोषण रोपण, यवनी दोषर, बीज धारण. After yoni abhyanga, Angshira-dhum Veshwar inserted into the vaginal canal and bandage applied can be kept till micturition reflex. Madhuravshadhi Siddha Vasa and Grutta pack inside the vagina and thereafter bandhan with kshom. Prepared bandhan is gofan in uterine prolapse. Avgah till kashay gets cold 20 minutes. Highly effective for basti roga, mutra sanga, mutra krucha, arsha, mutragat, guda roga, bhagandara. In Sutika Triphala Kashay, the Shamul Kashay, it's anti-inflammatory Shotar, Rujapaham, Prasut Kleshharam, in Evnikandu, Aragvat Kashay. उत्तर बस्ती उत्तर मार्गम दिय मानतया किंवा श्रेष्ठ गुणतया उत्तर बस्ती. उत्तर मार्ग means मूत्र मार्ग and shukra marga in male and mutra marga and yoni marga in females. Indications shukram dushtam shonitam cha anganam pushpadrekam tasya nasham cha kashtam mutragatam mutra dosham pravruddhan yoni vyadim sanstitam cha apreya. उत्तर बस्ती यंत्र बस्ती पुटक बस्ती नेत्र पुष्प नेत्र. टाइम ऑफ एडमिनिस्ट्रेशन अष्टांग संग्रह ऋतुकाल. प्रोसिजर, पूर्व कर्म, प्रधान कर्म, पश्चात कर्म. उत्तर बस्ती स्नेह प्रमाण गर्भाशय 1 pul, मूत्राशय 2 pul and balika 2 karsh. Yoni basti can also be uttar basti as it is via uttar marga. फलसर्पी in वंध्यत्व, अपत्यकर गर्भस्थापन, गर्भाशय पोषण. Conclusion, औषध सेवन मार्ग are the routes of administration of drugs. ततश्च स्थान विशेषण भेषज विशेषा परेषितव्यः. Ultimate aim cure of disease. Thank you.
Thank you, Dr. Vidya. Thank you for your cooperation. Next, I would like to invite Dr. Dhanashree Vital Gole for the paper presentation. Dr. Dhanashree, are you there? Hello, Dr. Dhanashree, are you there?
Yes, sir. Am I audible, sir?
Audible, doctor, audible.
Yes, sir.
Please share the screen, doctor.
Yes, sir. 1 minute.
Okay, doctor.
Is my screen visible, sir?
Yes, doctor, screen is visible. Please start the session, doctor.
Today's I'm going to present a meta-analysis of emergencies in ENT, its management, and an Ayurvedic approach towards it. What are all the emergencies that we find in ENT, and how already Acharya Shushruta has explained about primary steps to be taken, and how in today's era we are able to diagnose it even more better. Now, emergencies in ENT are a common occurrence. Early diagnosis and management result in reduction in mortality and morbidity. In this study, I have explained initial assessment, medical records, diagnosis on admission, and outcome of emergency care. Total patients that were attended as an emergency in our institution hospital, apart from the OPD timings, like from 9 to 4, that is the OPD timing. After that, those patients that come under emergency. So I've explained about all those patients here. And I've explained about every like nose emergencies, one among them, like your emergencies, one, not all the emergencies over here. The most common emergency among pediatric age group were foreign body in ear, nose, and throat. The other most important encountered emergencies were RTA patients with cut or tear wound, epistaxis. In traditional text of Ayurveda has mentioned terms like Vegavastha, Dhatugatavastha, Upadrav, Sadhya Lakshanas, Agantuj Vyadhis, Sadhya Ashu, etc. for emergency conditions which are need to be taken care of immediately. Now, the ENT emergencies play a very important role in the management of life-threatening condition requiring immediate evaluation and management. It is important to prioritize the emergency, non-emergency cases in order to ensure proper care is given to the emergency cases. Now, rational study. Why this study? This purpose of this study is to provide information on how ENT emergencies are to be handled. This condition, which are fatal and life-threatening, are considered as emergency condition which require specific treatment protocol. Ayurveda text explains many such diseases and conditions mentioned under Atyayik Chikitsa, where basic principles of handling various types of emergencies are explained thoroughly, which can be perfectly applicable in present era as it is or with necessary modifications. Now, most common emergency, foreign body. Foreign body in the nose and ear are common in children. A foreign body in the nose, unless impacted, may be inhaled and cause airway compromise. The best way of removal of foreign body from the nose is to encourage the patient to blow it out themselves. Although it can be very difficult in children, an alternate is to create a pressure behind the object to dislodge it. This can be done either by the parent blowing into the child's mouth while occluding the unaffected nostril, or can be manually removed with the help of probe, Jobson's probe that we have in our OPD. In our day-to-day OPD, foreign body is in ear is relatively second most common emergency. Various objects can be found in the ear such as toys, beads, stones, folded paper, biological materials such as insects or seeds. Most foreign bodies in the ear can be removed with the help of minimal risk or complication. The common removal method include use of forceps, water irrigation, and a suction catheter. Most objects placed in the ear may not cause signs. Other objects like food, bugs, they can cause hearing loss, redness, or ear pain. Acharya Sushruta in Sushrut Samhita Sutrasthan has explained that while traveling in a wheel cart on an irregular road, the large foreign body tends to hurt at that location. And this is how one is supposed to detect the location of an non-visible foreign body. In earlier days, there was no otoscope, no fundoscope, no laryngoscope. So this is Acharya Sushruta has explained that the foreign body which is not visible, how you come to know. And now in today's technical and advanced era, we have otoscope, video laryngoscope, endoscope, which makes it easy for us to diagnose the exact position where the foreign body is lost. Treatment. A suction catheter can remove the foreign body from the ear. A crocodile forceps can be used to catch hold the insect. Jobson's probe can be passed behind the foreign body and then it can be extracted. Sometimes surgery is required if other removal methods do not work. In children's, mostly when we are using crocodile forceps, suction machine, the children are not cooperative. In that, sometimes, in some cases, we have to give Finargan to the patient so that the baby can sleep. And after that, we can easily remove the foreign body. Acharya Sushruta in Sushrutsthan in Pranashta Shalya Vijnanam Adhyay has explained that if a foreign body is lodged into the strotas, it causes hampering or even loss of function of that particular strota. Hence, it has to be removed on priority basis. Acharya Sushruta has mentioned horn, teeth, hair, nose, bone, sand, wood, stones, and mud never get absorbed in the body. Hence, they have to be removed. Now, this there was a case in OPD. There was a 7-year-old boy. He came with pain and water discharge from left ear. So the patient, what we did, patient we give upright position. We saw the ESC, external auditory canal of left ear. With the help of otoscope, there was foreign body, tambourine seed lodged in the left ear of ESC. It was small. It can be easily catch hold with the help of crocodile forceps removed. Then there were blood stain which were cleaned with cotton. Again, attached to the Jobson probe. Then betadine solution was applied. And treatment, you can sometimes the patient gets fever at night. You can give ibugesic plus as per the need. Second most common emergency is epistaxis. Now, bleeding from the nose may occur as a result of various causes, ranging from insignificant trauma to malignancy. The blood loss may vary from a few drops to a massive loss of blood in liters. Now, Acharya Sushruta has, according to Acharya Sushruta, Puya Rakta can be correlated to epistaxis. Along with that, Acharya Sushruta has explained when there is trauma on the forehead, there is blood and pus discharge from the nose, and this condition is called Puya Rakta. If the discharged blood is due to vitation of dosha, it is called as dosaj. And when it is due to trauma, it is called as agantuj puya rakta. According to Acharya Vagbata, this disease is caused either due to vitation of dosa or doshas or due to trauma. Along with discharge of blood and pus from the nose, there is burning sensation and pain at the site of trauma. Common causes of epistaxis in children and elderly. One is foreign body in nose, nasal diphtheria, vestibulitis, hypertrophic adenoids as secondary congestion in the nose, or idiopathic cause. In elderly, it is mostly hypertension, malignancy, or any idiopathic cause. Now, there was this 45-year-old male. He came in OPD. That time he had trauma, which was hit by a wooden rod. Bleeding, there was continued bleed from the nose, pain at the nose, forehead, and burning sensation on the nose. Procedure we did basic was, first is a roller gauze soaked in adrenaline and xylocaine jelly was administered with the help of curved artery in the nose, and anterior nasal packing was done. The blood from the superficial skin was cleaned with betadine solution. Now, patient was checked for posterior bleed also. Injection pause 500 mg stat was given along with injection silent. Patient was given trotter's position, ice pack was held on the forehead, and tablet pause was given SOS. Before that, systemic management was blood pressure was to be checked to rule out hypertension. Then vitamin C as was given, antibiotics were administered, and post-nasal packing was done to avoid infection. Now, what are the management of laceration of deep injuries on the face? Management of face and scalp laceration and deep cut wound require immediate care and attention. In this, we need to consider unique anatomy, sound repair, and consideration of patient expectation for cosmesis. Laceration of deep wound of the skull and the face are commonly seen in cases of RTA. Following a systemic approach and considering the anatomical structure of the face and the vital organ, the medical practitioner should approach to the repair of wound, understanding and responding the patient's expectation and concern, which play an important role in the evaluation and management of the injuries. Because disfiguring facial laceration can cause significant emotional and physiological problems. Long-term cosmesis must be a central component and decision making around management. Facial laceration and wound often include traumatic injury to nerves and vessels that can have significant impact on healing, neurological function, as well as cosmetologically. The objective of laceration deep wound care is avoidance of infection and achievement of a practical and cosmetologically acceptable scar. Deep wound may involve blood loss. Therefore, initial management must be include assessment of stability by binding the bleeders, prior the treatment through patient history is necessary, and attention should be paid to factors affecting wound healing. Examination of wound, appropriate lightening and control of the bleeding are important to ensure that the foreign body can be identified. During examination, the characteristics of wound should be noted, including the time of injury and the shape, the length, and most importantly, the depth of the wound. The time of injury is most important because deep wound repair by primary closure is time dependent. Wound healed by secondary intention are at increased risk of scarring. Thoroughly examining the wound for any foreign body so as to prevent traumatic tattooing, a phenomenon that occurs when foreign bodies are retained within the tissue. Repair technique. Initial management consists of applying direct pressure on the wound for 15 minutes with lignocaine and epinephrine to achieve hemostasis. The presence of profuse bleeding or hematomesis warrants inquiry about hematological pathology. The skin of the face is thin on the human body and thus prone to tear and dimpling. This can be minimized by choosing the smallest suture. In most cases, 6-0 suture is used, involving multiple small bites. Now, special care in eyebrow and eyelid injury. Now, eyebrow laceration and wound are more often caused by blunt trauma to the supraorbital area. For any laceration involving the eyebrow, eyelid, a full and careful examination of the eye is required before repair is performed. The examination should include assessment and visual acuity and extraocular fluorescence stain for third of the upper or lower eyelid can cause damage. Along with the injury to eyebrow and eyelid, it is important to look for clues that gives suspicion of deeper injury. Example, copious tear may indicate injury to the tear duct, whereas an acute case of strabismus post-injury indicates injury and protrusion of fatty tissues from the wound should raise concern for a raised orbital septum. An acute ptosis post-injury may indicate injury to the levator palpebris superioris. Sutures is not necessary for wound less than 0.5 cm that are located above or below eyebrow. Now, this patient, he was 25 years old, road traffic accident. The laceration was 3 into 24 centimeters above left eyebrow. In this, first we did was thorough wash with NS was given. His wound was cleaned with betadine and H2O2 solution. Simple interrupter sutures were taken with Echelon 40. Padding and dressing was done. And antibiotic, antacid, anti-inflammatory were given. After, for gentle washing twice a day and to apply topical antiseptic thereafter. In the injury of eyebrow, hair should not be shaved because regrowth of hair cannot be guaranteed. But in this case, eyebrows hair were removed because they were disturbing the operative field and as well as they would contaminate the wound. So, and the presence of hair complicated for me to laying of the knot of the sutures. Hence, I had to remove those eyebrows. Second, this was also a case of road traffic accident. Same laceration he had above left eyebrow. Same procedure was done with NS. Thorough wash was given, clean with betadine solution. Sutures were taken with 40. The suturing of the eyelid eyebrow, especially eyelid, padding and dressing was done. In this case, eyebrow was removed. Important. It was removed, and it is very important to take written consent of the patient before removing the eyebrow, because in some cases there might not be a regrowth. In this case, care was taken that no injury of stretching of eyelid muscle or ligament should be there, because if there is injury to the levator palpebrae muscle, patient will land up into tossing. And after post-treatment, post-suturing, antibiotics, antacid, anti-inflammatory were given. Now, ear injury. Ear laceration or injury usually is a result of blunt trauma to the head. Therefore, most important initial consideration is assessment of potential for serious brain injury, for checking patient for altered level of consciousness, impaired breathing, or signs of basilar skull fracture. After these signs have been ruled out, the evaluation of wound should be done for location of laceration, amount of cartilage involved, and depth of injury. Basilar and middle ear trauma can be assessed with the help of otoscope. Now, this was 22-year-old male. He had a hit by a stone, a split injury to the helix of the right ear. So, whenever ear injury, patient is there, first to check the EAC with the help of otoscope to check if there is traumatic tympanic membrane perforation. No injury was noted, hence thorough wash with NS was given. Same basic protocol of cleaning with betadine H2O2, simple interrupted sutures were given, and you have to see how much the cartilage is involved. Mostly you have to see that you avoid the cartilage, and then sutures were taken. It requires both subcutaneous closure with absorbable suture and skin closure with non-absorbable single interrupted suture. This was again a 40-year-old RTA patient, cut laceration, wound at right ear. Patients first, again as protocol, EAC was examined with otoscope to check if there is any injury inside the ear, perforation of tympanic membrane present or not. There was no such perforation. Then again, same procedure of washing with NS, then betadine H2O2 solution, suture. This is a complex injury in which cartilage was exposed. Hence, it was really carefully be repaired. Properly attention was paid for approximation the cartilage and ensuring the cartilage properly covered by the skin to prevent deformities. Because the skin overlying the cartilage is thin, the suture should incorporate the two layers. Suture should never be buried in the cartilage. All subcutaneous stitches were buried in the perichondrium using 5-0 absorbable suture, and special care was taken to gently approximate the cartilage without or damaging the fragile tissue. On follow-up, this patient, on follow-up, he had a lot of discharge from the wound. Looking at that patient, we increased the dose of the antibiotics, and plus as after doing tympanoplasty, we have that bunda pressure bandage I gave this patient. Then his wound was healthy. He started recovering. The discharge also was less after that. Debridement of cartilage is also not recommended unless the laceration involves infection of the edges as severely deformed. In those conditions, debridement should be kept to a minimum to prevent nothing and preserve cosmetics. Contraindication to ear laceration repair include evidence of basal skull fracture, infection, total auricular avulsion, extension of a laceration into the auditory canal, or hearing loss caused by the injury. In this case, patient should be immediately referred to otolaryngologist surgeon. Acharya Shushruta and Suprasthan Panchavinshati Adhyaya has explained Ashtavid Shastra Karma. In that, Sivan Karma is explained. According to Acharya Shushruta, in Meda, incised and well-spread lesion, fresh wounds, and those situated in moving and non-moving joints and at head, orbit of eyes, ear, thigh, hand, neck, forehead, scrotum, penis, buttock, and abdomen. Sutures are applied in disorders causing Meda, incised, and sutures when should not be taken. Suturing should not be done in wound affected with caustics, cauterization, or poisoning, carrying in air, and having inside blood or foreign body. In that case, wound should be cleansed properly. If dust, hair, nails, and bone pieces, etc., are not removed, they may cause severe suppuration of the wound along with various types of pain. Hence, this should be cleaned. Then raising the wound and placing it in proper position. It should be sutured slowly with fine fibers of ashmantak bark, hemp, or flax ligament, or hair, or fibers from the stem of murga or guduchi by the method of continuous suture, or that of reinforcing or darning of interrupted suture according to suitability. Suchi needle for the part with little musculature and joint should be circular and of 2 fingers in length. For fleshy part, 3 fingers long and 3 edged. White. wide for vital spots. Scrotum and abdomen, it should be curved like bow, semicircular. It should be around, it should be round like tip of the pedicle of the jati, that is jasmine flower. Suture should be made neither very far nor too near from one thing to another. If the puncture are far apart, they will give rise to pain in the edges of the wound, and if very near, the edges will get torn. After suturing well, wound should be covered with linen and cotton and the powder of Priyangu, Anjana, Yashti, Madhu Yashti and Lodra, or that of Shalaki fruit or ash of linen should be sprinkled all around. Then after bandaging the wound properly, post-operative management should be instructed to the patient. Deficient, excessive, oblique, faulty incision and injuring one's own body, these are the 4 derangements of the 8th surgical operation. When a surgeon applies sharp instrument deficiently due to ignorance, greed, enemies, words, fear, confusion, and other such emotion, he is liable to produce other such complication as well. Now, nose injury. Nose injury is both cartilaginous and bony component. And injury to it is common, often seen as a result of physical assault and unintentional support-related traumas. Taking a proper patient history is very important in nose laceration because the mode of injury is a vital detail suggestive of other systems that should be assessed. For example, significant blunt trauma as well as assault by basketball bat require an extensive ocular, neurological, and dental examination along with evaluation for more significant facial bone injuries. Examination of the patient with nose laceration should include both internal as well as external inspection with concentration on possible obstruction and breathing difficulties. Sign of basilar fracture, which include immediate neurosurgical consultation, include the emission of clear fluid from the nares, hemotympanum, Raku sign, battle sign, ecchymosis around the mastoid. The nasal hematoma may occur in patients with nasal laceration appearing as a dark blue or purple tender mass at the septum. A septal hematoma increases the risk of cartilage damage and subsequent deformity and may signal the pressure of basilar fracture. The appropriate treatment is drainage and examination of the fluid followed by pressure packaging. Now, this was a 35-year-old patient, RTA patient, cut laceration around on the tip of the nose. Now, the cartilaginous injury were easily seen through the open wound. A speculum examination of the internal nose first was done to check if there was mucosal laceration. A thorough wash with NS was given. The wound was cleaned with betaline H2O. Simple interrupted sutures were taken. The laceration of cartilages was repaired with non-absorbable 6-0 suture. There was no need for cartilage graft. All layers were repaired appropriately. The skin around the nose were repaired by placing key sutures are at the rim of the nose using 4-0-ethylene. The nasal suturing, external covering from frame and lining should be considered. Nasal laceration injury usually involves multiple layers, skin, mucosa, and cartilage. Hence, in this case, suturing, closing the skin and mucosa with the closest approximation as possible is important to prevent notching and deformity. Suturing cartilage is unnecessary because it is because its coverage by skin and mucosa ensures healing. However, if the cartilage cannot be completely covered, the risk of chondritis and deformity is increased and referral to a plastic surgeon. Lip injury. Now, epilogues and lacerations are many, ranging from assault to fault. Because the lip is rich in vascularity, laceration tend to bleed profusely, and they are a very common presentation in the urgent care. Indication for repair of lip laceration include a wound which is larger than 0.25 centimeter or the ones that gapes at rest. Macerated wounds association facial bone means which we should not be taken or which we should report to the plastic surgeon. Macerated wounds association facial bone fracture, suspected injury to the orbicularis muscle, large areas of missing tip tissue or wound left unrepaired for more than 12 hours are necessity management for a plastic surgeon. In patient whose laceration can be repaired, perform a complete exploration for foreign body and a dental check for missing or broken teeth. If there are any teeth missing, a facial X-ray should be considered. This was a 12-year-old case of self-trauma she had. A laceration of the left commissure of the lip. Same procedure as we do, it was done like giving NS wash, then cleaning with bitter H2O, simple interrupted suture was given. In this, a female of 12 years, there was through and through injury, through and through cut. Hence, as it is lip is very vascular, hence and soft tissue. While suturing, too much care needs to be taken. Conclusion: CLW of the face and epistaxis, it's emergency treatment, but the most frequently ENT condition seen in the emergency department. The basic principle to be followed while treating an emergency patient were given by Acharya Shushruta in Shushruta Samhita, with advanced equipment and technology which has made it easy to treat an emergency patient. The goal of my this paper presentation was to provide some knowledge about the common emergency scene in ENT, which can be easily handled, and convey knowledge of some basic protocol to follow while handling them. The treatment which is to be given and some things that need to be taken care of while treating the patient is mentioned here. This is just a sincere attempt to forward basic information to my colleagues and juniors, which will in turn help and also upcoming PGs of Shala. Thank you.
Thank you, Doctor. Next, I would like to invite Dr. Dinesh Sundake for the paper presentation on the topic local toxicity of Semicarpus anacadium, Vatakandaka. Dr. Dinesh Sundake. Dr. Dinesh, your screen is visible. Please unmute yourself. Hello, Dr. Dinesh. Please unmute.
From Bhosep Modak Ayurved Mahavidyalaya Nagpur. Hello.
Hello, your voice is clear, doctor. Please continue.
Guide Rajendra Urade and Mokta Hadav. My case report is local toxicity on Semicarpus anacardium. Department of Agat Tantra and Vyavhar Ayurved. A patient 12 years old male come to outer patient department with chief complaints of sign and symptoms like blackish discoloration, itching, burning pain on hand and back of neck since 3 to 4 days. History of present illness. Patient was apparently all right 3 months back. He experienced severe itching and burning pain on hand and back of neck. For that he went hospital and they gave diagnosis of tinea corporis. Since 3 to 4 days he noticed dark lesions and multiple eruption with each it comes in contact. It's painful in same area. It was slow growing and tender. For that came to our department for treatment. Past history. Patient gave a history of application of Bhalatak seeds extract on hand and back of neck. General physical examinations. Patient is conscious, well oriented and time place at person build aesthetic nutrition status normal height and weight 4 and 32 kg, gait posture normal, speech pallor icterus sinus clumping absent. Next, vital signs: BP 120 by 80, pulse 70 beats per minute, respiratory rate 16 cycles per minute, temperature febrile. Physical examination on inspections, a dark lesion with resemble the bruise of size 4 into 5 centimeter approximately on the hand and 3 into 2 centimeter approximately on back of neck. Shape oval overlying surface rough and scaly appearance on palpitation. All inspectory finding are confirmed on palpitation, a lesion tender and blood discharge on probing. Summary: 12 years old male was came to our department with chief complaint of black discoloration, itching, burning pain on hand and back of neck. Gave history of application of Bhalatak seed extract on hand and back of neck. On inspections or dark lesion which resemble a bluish eczematous eruptions, blister like with which it comes in contact. It's painful. Next, investigations: complete blood picture, hemoglobin 4.8 gram per dl, WBC raise 12,500, neutrophil also raise 85, lymphocyte 12%, monocyte 2 and eosinophil 1. Final diagnosis: local toxicity of Bhalatak, semicarpus anacardium. Treatment give patient clamp 1 PID Flexon, Fentop 20 OD for empty stomach and local T-backed ointment for local application before treatment, after treatment. Next discussion. Semicarbos anacardium is generally classified in Ayurveda under category of toxic plant. Semicarbos anacardium is usually kept on away from pediatric group, age, pregnant woman, predominant pitta prakriti person, bleeding, diathesis, renal function disorder, history of vesication, past history of allergy, and semicarbos anacardium. Adverse effect: generalized itching, vesications, erythematous patch, mucocutaneous popular. Eruptions, stomatitis, gastritis, proctitis, and urethritis. It is some despite of many significant use of marking nut, there are some adverse reaction like contact dermatitis. We have been reported allergic contact dermatitis is severe condition that can caused by various phytoconstituents and their derivatives. Further, it was observed that severity after the administration of antibiotic agent azithromycin, which is idiopathic. Hence, people should be vigilant and acquire knowledge when they are subjected to the treatment of system of medicine. Reference says, thank you. Hello. Hello.
Thank you, doctor.
Thank you. Thank you, sir.
Next, I would like to invite Dr. Kalyani Mahesh Patankar for the paper presentation on the topic Ayurveda Rejuvenation Therapy and Disease Prevention. Dr. Kalyani, are you there? Hello, Dr. Kalyani, are you there?
Hi, sir.
Hey, doctor. Please share the screen, doctor.
One second. I will share my PPT presentation. कसं काय share करताय?
The screen is not visible, doctor.
Yeah, I will try, but
Hello, sir.
hello,
Hello.
hello. Can you please
Doctor.
share my PPT?
Okay, doctor. On minute.
Okay, thank you.
Doctor, screen is visible. Doctor, screen is visible.
Okay. Can I?
Please start the session, doctor.
Okay. Hello. I myself, Dr. Kalyani Patankar. Hello. Am I audible?
Audible, doctor. Please continue.
Okay. Myself, Dr. Kalyani Mahesh Patankar. I am MD scholar of Sasurta department from KC Ajmera Ayurved College, Devpur, Dhule. My topic is Ayurvedic regeneration therapy and disease prevention. In Ayurveda, regeneration is called as rasayana. The term rasayana is specially referred to nutrition and nourishment. It could be dissociated as something that destroy old age and disease. Regeneration is a key to claim and maintain a high efficient mind, body, and soul. The Rasayana or regeneration therapy aims at optimizing the functions of enzymes in our tissue cells by revitalizing them. Our regeneration therapy revitalizes your nervous system, heals and strengthens our bone. It stimulates the function of your brain, boosts your concentration, and bring in a sense of peace. All these slow down the age and boost our overall health, wellness, and lifestyle quality. There are many mechanisms through which Rasayana remedy accelerate the phenomenon of nourishment and logic. Logically, it seems that Rasayana may act in a three levels. Level term as Agni, then level of Srotas and the Rasa itself. Agni, by promoting the digestion and metabolism, at the level of strotas by promoting the microcirculation at the level of rasa itself by acting as a direct nourishment. Rasayana therapy helps in maintaining health, prevention of disease, and also gives the power to the body to avoid the recurrence of the disease. As we know, in this modern era, every human being is living under the pressure to survive. The stressful life harms our health, happiness, and inner sense of well-being, increase the toxicity in society. Pollution and uses of excessive chemical-based products are also the big degenerative factors that leads to the health problem, and they are the root of many fatal diseases. So in this condition, Rasayana therapy becomes very necessary to rejuvenate the body system for the better harmony in the body, mind, and soul. Ayurveda has a two main objects. First is to maintain the health of healthy person, and the second is to cure the disease of the suffering one. Hence, thus Rasayana therapy is also known as the rejuvenation therapy, which aims to restore the body vigorously and vitally. Introduction. The term Rasayana used in the Ayurveda denotes the specific meaning. It consists of two words. One is Rasayana and two is Ayana. Grammatically, the speaking of the word Rasayana means the way of obtaining the good quality of rasa. The word rasa is also represent the seven dhatu because they all nourish our rasa and yield of the rasa. Acharya Charaka has described rasayana as the meaning of the obtaining the best quality of rasadi dhatu, that the tissue elements. Best quality of rasa leads to formation of the best quality of other dhatus. Thus, the rasayana is also the process by which all the body tissue are nourished. Consequently, rasayana helps in the regeneration, revitalization, and revival of the body tissue and dhatus. According to the Acharya Sushruta, they has defined the Rasayana as the measure which deals with the problem of young age, prolong the longevity, and develop the positive health, mental faculties, and impart resistance and the immunity against the disease. Rasayana therapy improves the physical, mental, and inner qualities. It prevents the aging problems, restores the youthfulness, increases the body and mind strength, and increase the immunity of the body, control the tension and the stress of life. Aims of objective of Rasayana therapy. Rasayana therapy is a part of Ayurveda which deals with the healthy life, longevity of the human being, and fight against the disease to maintain the health of the deceased person and gives the strength of the all dhatus. Rasayana therapy improves our inner immune power and keep away the old age decline of the life. So, Rasayana therapy is very important to retain the youthfulness of body, mind, and useful for both healthy as well as the well diseased person. Classification of Rasayana. According to mode of administration of Rasayana, there are the three types. Kuti Praveshik Rasayan, Vatatapik Rasayan, and Droni Praveshik Rasayan. According to the second one, according to the purpose of administration, Kamya Rasayan to promote the normal health, Prana Kamyam, hello, Prana Kamya, promote the life of validity and longevity, May the Kamya, promote the intellectual, Sri Kamya. According to the modes of action, Samar Samashodhan Rasayan, Sama Saman Rasayan, and Acharya Rasayana, conduct the Rasayana, Ahar Rasayan, Achar Rasayan, and Dravya Rasayan. According to ages, uh, the Rasayana according to the ages are the classified according to the age group as 1 by 10, 11 by 12, and so on. There are the age 1 by 10 is Balya, direct desire, and Rasayan Dravya is Vacha, uh, Suvarna, like all that converted. Herb rasayan, herb medication used for the rasayana therapy is ashwagandha, amalaki, haritaki, shatavari, pipali, bala, brahmi, shankapushpi, vacha, gugul, and punarnava. All have their individual effects. Like ashwagandha cures and corrects the nervous disorders, amalaki stops the aging process, haritaki Haritaki eliminate the waste product and improve our digestion. Shatavari promote the lactation in lactating mother, useful in fertility, libido, and women's health. Pipali useful in respiratory and give the strength of our tissue. Bala give the strength of our body tissue. Brahmi, Shankapushpi Vacha improves our memory power, gives sharpness and intelligence. Google, Punanava promotes the waste product digestion in tissue and promote the kidney function. Precautions. We have to take some precautions by giving in the Rasai therapy, just like one against the anger and violent nature, like sex, mental stress during the therapy. You should avoid this one. Steps of Rasayana procedure and their benefits of Purva Karma. Purva Karma we have to do Purva Karma like Snehan, Svedan, Samashodan, Samajirna, and avoid the negative attitude against the all therapy, like Rasayana therapy. Then Falashruti of Rasayana therapy is longevity, vigor, strength, immunity, vitality, and mental competence. Benefit of Rasayana therapy. The Rasayana therapy has many benefits and it has a very important in many way are giving below. It rejuvenate our body tissue, keep body young and agelessly, improve immune system, increase resistance to the disease, increase physical and mental strength. Rasayana in the disease prevention. As Rasayana are useful in strengthening the body tissue and can replenish the body tissue. It plays important role in every diseases. It helps in re-aging the strength, stamina, and weakness that our lost during the fighting against the disease. It also plays a very important role to avoid the recurrence of the disease and its complications. Generally, the Rasayana medicine are useful along the other active management of disease as well as after active treatment is completed. Hence, it is very clear that the treatment of disease cannot be considered as a complete without using Rasayana. So, in view of specific pathology of disease and its effect on the body tissue, specific properties is the different health or medicine can play the better role in regeneratory in the different diseases or system affection. Discussion. Rasayana therapy is very important for us to keep fit and healthy. Without this, we can't be, will not be above in living healthy. The various type of rasayana are also useful for specific disease and eliminating as well as general use. Rasayana, rasayana activity of herb and medicine can be interpreted with the modern aspect like immunomodulatory action and anti-aging action. Conclusion. The regeneration therapy has unimaginable and wonderful effect. It promotes the health and maintains positive life, and it prevents the youth and cure the morbid sleep, drowsiness, physical as well as mental fatigue, laziness, and weakness. It maintains the proper balance against the Vata, Pitta, Kapha, three doshas. It product the stability, cures the stiffness of muscle, stimulation of muscle, stimulate the digestion and metabolism. The Rasayana therapy is that which regenerate the whole body and make a new and disease-free body. The importance of the part of this Rasayana therapy is impeded the aging process and prevent the degenerative process in the body by rejuvenating the body tissue. In this way, we find that the Rasayana therapy is the kind of regeneration therapy as well as preventive therapy. And there are some references. Thank you. Hello.
Thank you,
Thank you,
doctor.
Dr. Kalyani.
Thank
Next,
you.
I would like to
Next,
invite
we have a
Dr.
paper. Next, we have
Next, I would like to invite Dr. Minal Edenkar for the paper presentation. Dr.
Yes,
Minal Edenkar, are you there?
yes. Hello, sir. Hello. Yes.
Okay, doctor. Please share the screen, doctor.
Yeah, sure. Hello. Hello,
Your
sir.
screen is visible, doctor. Please start the
Yeah.
session.
Hello, sir. Myself, Dr. Minali Tankar, PG scholar of Bhausaheb Murak Ayurvedic Mahavidyalaya, Nagpur, of Agatantra department. My topic is Ayurveda and modern aspect of Dhatura according to Agatantra and Vyavhar Ayurveda. Introduction, Latin name Dhatura stramonium, synonyms thorn apple, devil's weed, Dhatura, Kantakphala unmata. Type of poison according to Ayurveda it is Akutrim, Sthavar, Vanaspatij and Phalavish. Type of poison according to modern neurotoxic cerebral delirant poison. Physical appearance, plant grows on high altitude, having bell-shaped flowers, fruit covered with sharp spinous projection, having 300 to 500 yellow seeds. All parts of plant is poisonous, though fruit and seeds are more poisonous. Seeds are light brown in color, katu rasa, and contain minimal oil. Concentration of poison is more in seeds. Kidney-shaped seeds may be confused with capsicum seeds. Active principle, Dhatura contains hyoscine, hyoscinamide, and atropine. Mechanism of action, they block the acetylcholine receptor, thus produce sympathomimetic or parasympathetic action. According to Ayurveda, Dhatura is categorized under Pralapak Visha. Signs and symptoms, after ingestion of churna, bitter taste, mouth, dryness of mouth, difficulty in swallowing and taking excessive and talking, excessive thirst, rise in temperature of the body, vomiting, giddiness, difficulty in walking, hallucination and vision diminish, trying to catch invisible things. According to modern science and symptoms appear within 30 minutes of swallowing. Features classically described as dry as a bone, red as a beet, blind as a bat, hot as a hare, mad as a wet hen. Two stages of manifestations are stage of delirium and stage of coma. Postmortem appearances, intact seeds resist putrefaction, condition of stomach in all other viscera is present, residues of crushed seeds particles may be present in stomach content. Medical legal importance, it's commonly known as a roadside poison since it is used as roadside crimes like robbery, theft, kidnapping, and rape after stupefying the person. Dhatura seeds may be given in food like chapati, curry, sweet or tea, wine, or cigarettes. Commonly used in fairs, railways, and by the sadhus and pujaris. The stupefying dose is 30 to 50 seeds, sometimes used for suicide or homicide. Accidental poisoning is common. It considered aphrodisiac, resist putrefaction. These are the references, and thank you.
Thank you, doctor.
Yes, sir. Thank you.
So next we have a paper presentation, and I invite Dr. Kiran Ramesh Dikshit for the paper presentation. I invite Dr. Kiran for the paper presentation.
Dr. Kiran, are you there? Next, I would like to invite Dr. Rajani Angadi for the paper presentation on the topic Trivida Pariksha and its application. Dr. Rajani, are you there? Hello, Dr. Rajani, are you there? Okay, next I would like to invite Dr. Benashangiri HL for the paper presentation on the topic Fundamental Concept of Agni. Dr. Benashangiri? Dr. Benashangiri, please unmute yourself. Hello, Dr. Benashangiri?
Yes, doctor.
Okay, doctor, please share the screen, doctor.
Oh, 1 second.
Share kudu.
Dr.
Dr.
Benashangiri,
Benashangiri?
please start.
Doctor, you have any problem with screen sharing?
Respond.
Yes, sir. Hello.
Dr. Benashangiri. Problem share.
Yes, doctor.
Doctor, you have any problem with screen sharing?
Sharing problem is there. Can you?
Okay, doctor, I will share for you, doctor.
Oh,
Your
okay.
screen is visible, doctor? Dr. Benashankari, screen is visible. Please start the session, doctor.
No, not visible. Not visible. Visible, doctor.
Doctor?
Thank you.
Okay, please continue, doctor.
Myself, Dr. Banshankari HL, PG Scholar, Department of Kaya Chikitsa, ALN Rao Ayurvedic Medical College, Koppa. Uh, Concept is fundamental concept of Agni. Introduction. Agni being a vital concept, it helps in understanding the pathology of disease as well as treatment of it. Kayasya Antaragni Chikitsa, Kaya Chikitsa. Kaya Chikitsa is a branch of Ayurveda, mainly deals with Agni Chikitsa itself. The term Agni generally means fire. Ingested food is to be digested, absorbed, assimilated, which is unavoidable for the maintained of life. Agni is invariable agent in this process. Next. Etiology Agi Gato Dhatu Amarakosha. The word Agni is derived from the Agni Dhatu, a particular substance which goes continuously and through which perception of knowledge is made possible. Agni is the one which brings about the transformation of consumed ahara viharadi dravya of vijatiya origin to sajatiya nature. Next. The place of Agnadhisthanamanasya Grahanat Grahani. The seat of Agni is Grahani. Grahani is named as it receives the food. Its placement is in between Amashya and Pakvashya. Synonyms Ushma, Anala, Vaishwanara, Pachaka, Pitta. Next. Pitta is considered as Agni. Agni itself is present in the body in the form of Pitta. When it is normal, performs functions like maintenance of normal digestion, normal vision, normal body temperature, normal complexion, valor, happiness, and nutrition. When it is abnormal, all these functions also will be abnormal. Next slide, please. Agni and Rutu Sambandha, where Agni will be Pravara Bala in Shishira and Hemanta Rutu, in Vasanta Sharad Madhyama Bala, and in Grishma Varsha Avara Bala. Next. Types of Agni, Jataragni, Bhutagni, and Dhatwagni. In pathological conditions, there will be Mandagni, Tikshnagni, Vishamagni, and Samagni. Bhutagni are five, Bhauma, Apya, Agneya, Vayavya, and Akashiya. And Dhatwagni, respect to the Saptadhatu, Rasa, Rakta, Mamsa, Medo, Asti, Majja, Shukragni. Next. Jataragni, Kayagni, Nirvartaka Agni, Jataram, Jataragni. Jataragni is the most important and master of all Agni because all the other Agnis are under direct control of it. It's located in the Jatara. The function of Jataragni includes the breakdown of food, what we consume into its elemental level, and separation of Sarabhaga and Kittabhaga. Next. Wherein Agni, there are four types: Samagni, Vishamagni, and Tikshnagni, and Mandagni. In Samagni, there will be Samyak Pachana. In Tikshnagni, Ashu Pachana. In Mandagni, Chirat Pachana. Vishama, there will be Vishama Pachana. Bhutagni, the body is made up of Panchamahabhuta and it is maintained and nourished with Bahya Panchamahabhuta Amshas. Parthivagni digests Parthiva part of food. Likewise, every type of Agni digests its own type of food. Next. Dhatvagni, after Bhutagni Paka, the Ahara Rasa circulates in the body. The seven dhatus contains their own Agni in them. This Agni will act upon concerned nutrients and in Ahara Rasa and helps in formation of two portions. One is Sara Bhaga and Kitta Bhaga. Next. Next. In Agni Dushtikarana, there are Abhojana, Jirna, Atibhojana, Vishamashana, Asatmyahara, Guru Shita, Tikshnahara, Vadikarshana, Deshakala, Rutuvaishamya, Vega Vidarana. ಅಗ್ನಿದೃಷ್ಟಿ ಲಕ್ಷಣ ಆಲಸ್ಯ ಅರುಚಿ ಆಮ್ಲ ಉದ್ಗಾರ ಗೌರವ ಉದರಶೂಲ ಚರ್ದಿ ಅತಿಸಾರ ಎಕ್ಸೆಟ್ರಾ. ಸಾಮಾನ್ಯ ಚಿಕಿತ್ಸಾ ದೀಪನ ಪಾಚನ ಅನುಲೋಮನ ಶಂಸನ ರೇಚನ ವಮನ ಬಸ್ತಿ ಅಂಡ್ ಶಮನೌಷಧಿ. Next slide, please. The role of Agni in the causation of digestive disorders. Roga Sarvapi Mandagni, hypofunctional state of Agni is the root cause of all diseases. The Agni Mandya and Ajina, these are the digestive disorders caused by the malfunction of the Agni. Next. Next. In Agni Mandya, treatment will be Nidana Parivarjana, Gritapana, Hingvashtaka Churna, Pachana Lavana, Chitrakadi Vati, Shankavati, and Agni Thundi Vati. In Ajirna, Ama, Vishtabda, Vidagdha, Ajirna, to give Shankabhasma, Panchakola, Churna. In Rasashesha Jirna, Diva Swapna Varjita, Shankabhasma, Pachana Churna can be given. Next. Next. Grahani, Tagragruta, Dashamuladigrutta, Nagaradhikwata, Madhukasava, Chandanadagruta can be given. Next. In Bhasmakaroga, Kolasti, Majjakalka, Udambarakalka, intake of 3 Sneha, Triphala, Loha. These are the treatment of Bhasmakaroga. Next slide, please. Next. Drugs acting at different levels of Agni, Mandagni, Chitraka, Punarnava, Trikattu, Vishamagni, Jiraka, Hingu, Haridra, Adraka, Tikshnagni, Shatavari, Amlaka, Ajumoda, and Dhanyaka. Next, in Dhatvagni, in Rasagni, Kharjura, Draksha, in Rakta, Manjishta, Sariva, Mamsagni, Guggulu, Kshara, Medagni, Guggulu, Triphala, Agnimanta, Astagni, Laksha, Nagabala, Shallaki, etc. Majjagni. Conclusion. Samadosha, Samagnischa, Samadhatu, Malapriya, Prasanna, Atma, Indriya, Manaha, Swasta, Ityabhidiyate. One is in perfect health when the 3 doshas, digestive fire, all the body tissues, all the functions of urination and defecation are in perfect order with a pleasantly disposed and content mind, sense, and spirit. In most of the disease, sometimes of Agni Manda is often found. Therefore, understanding the concept of Agni and its practical applicability is very essential for an Ayurvedic physician as well as an Ayurvedic scholar. Thank you. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Kiran SS for the paper presentation on the topic Understanding Avarna. Dr. Kiran, are you there? Hello, Dr. Kiran, are you there? Dr. Kiran, please unmute yourself. Hello, Dr. Kiran.
Yes.
Doctor, please share the screen, doctor.
Actually, it's not sharing. Could you please share the slide?
Okay, doctor, 1 minute. Doctor, your screen is visible.
Yes.
Please start the session, Doctor.
Understanding Avarna by Dr. Kiran SS, first year KCPG. Please, next slide. Nirukti, according to Sabdakosha, Avarna means avarodha or gati nirodha, that is obstruction or resistance or friction to the normal gati of Vata. As Pitta, Panku, Kapha Panku, Pangve Malak Dhatvaha, only Vata has the function of movement. So in Avarana, we have to consider mostly the movement of Vata. Next slide. Synonyms of Avarana which are used in Samhitas are in Kasa, Charaka Chikitsa for Avarana, Pratikata word has been used. Artavakshaya in the concept, Avrita Marga has been used. Similarly, in Madhumeha, Avrita Gati word is used as a synonym of Avarana. Next slide, please. Okay, as there is Vata, Arka, and Soma in the universe. Similarly, there is Vata, Pitta, Kapha in the body also. So, based on its Shayam, Vriddhi, and Samatva, a bishop should treat the person. Next slide. Understanding Avarana, Avyahar Gatitasya Sthanasya Pragaprato Sthita Vayu Syat Dikam Jivaditva Rogo Samashatam. That is Avyaharta Gati, that is normalcy of Vata dosha, that is without any obstruction doing its Prakrata Karma. Chakrapani in commentary, that is said as Apparyak Tiryak Swamarga. Sthanasya means in its own place. Prakupita Sthana, Prakupita Sthita, its normal function. If a Vata goes in this own manner, there will be 100 years for a person. Next slide, please. Okay. For us understanding, you can structurally represent Avarana as this. Actually, Avarana is not a structural entity, but just for our understanding, Avrata will be your center thing, and Avaraka will be the outermost thing. Next slide. Next slide. Grows to micro level understanding of Roga and its Chikitsa, Pratyatma Lakshana Vyadhis. In that, we should do Vyadhi Prataniga Chikitsa. Second, in Sroto Dushti Lakshana, Sroto Dushti or Sroto Dushti Chikitsa should be done. Kshayam Vriddhi Samatvam Cha Tadhaivam Avaranam Vishat Vigneyo Pavanadinam Na Pramuhayati Karmasu. Based on dosha, dhatu, and mala, dushti lakshana, its vriddhi, kshaya, avarana, treat accordingly. Next slide. Clinical interpretation, muhur baddha, muhur drava. In that condition, grahani roga, first we'll be giving takrarishta and grahani kapata rasa. Assuming it as Grahani Roga, in the next stage, same Grahani Roga, we will be taking it as Muhur Baddha, Muhur Drava as an Annavaha Sroto Vikara. So there, Ama Pradoshaja medicines will be given for Ama Pachana, Agni Deepana. Same Grahani, we can take it as Samana Avrata Apana. So there, Agni Deepaka Grita has been mentioned. Next slide. So, point to keep in mind, we can take Avarana as a part of Samprapti. So, we can take Avarana as a pre-disease condition. Its features depend on how much Avarana has occurred, where it has occurred, for how much time it has occurred. Next slide. Types of Avarana. Totally, there are 42 Avaranas. Anyonya Avarana 22, Anyonya Avarana 30, Anya Avarana 22. Next slide. Difference between Avarana and Sangha. It is the avarna of vata dosha by another dosha or dusha. In sangha, the pathway of dosha and dusha are being obstructed. Okay. Example and stage of paresis where there is a reduction of function, it can be taken as avarna, avarna condition, and can be reverted back with much ease as compared to paralysis where this stage is complete loss of function, and dhadukshaya can be taken as sangha, which is very hard to treat and revert back. Next slide, please. Avarna and chikitsa. In our acharyas, they have said each avarna, their lakshanas and their specific treatments. So lingam vittavrte daha, for each treatment they have given lingam vittavrte daha, daha strikshna shula brahmastamaha, kattvamla levanoshna vidahi shita kamita. For each avarna, for vittavrta they have given vittavrte visheshena shitam ushnam tadha kriya, shitam and ushna kriya as a vyathyasa chikitsa should be done. Next slide. Some correlation. अतः प्रमेह चिकित्सा प्रमेह व्याख्यास्यामः. आस्या सुखं स्वप्न सुखं ददीनि ग्राम्योदक अनुपरस पयांसि नवान्नपानं गुडवैकृतं च प्रमेहकृत् कफकृत् चर्मं. पित्तावृतवाद निदान is संतर्पणजन्य द्रवात्मक गुणात्मक वृद्धि happens स्थानिक or सार्वदेहिक. It can be amlapitta, pre parinamashula or heat stroke. Next slide, please. As I said before, for each avarna, its treatment has been mentioned. Next slide. Next slide, please. Okay, thank you. Next slide. It has been noted that in Madhumeha, Kapha, Pitta, Meda, and Mamsa are vitiated due to their own etiological factors as described here. These vitiated doshas and dushas obstruct the pathway of Vata, which in turn get provoked, leading to Madhumeha. Here, the treatment is to be done for dushas while protecting the Vata. Next slide. Next slide. In Madhumeha, this Samprapti of Vatika Prameha includes Madhumeha lists all the vitiating factors of Vata. Hence, here Vata is provoked by its own Swanidana, and provoked Vata moves in the body, and whenever obstructed by Vasa or Lasika or Majja, leads to various types of Vatika Prameha. In this Samprapti, Vata is vitiated by its own etiological factors. Then Parityak Gati of Vata leads to Vyahat Gati of Vata, that is Avarna. In this condition, there is no true Vriddhi of Avaraka, whereas Karma Vriddhi of Vata is also found. Next slide, please. Thus, these two Samprapsis are again an example of two types of Avarna leading to one clinical presentation, that is Madhumeha. These two conditions have to be managed by two different principles of treatment. In first case, the treatment of Meda Pradhana dosha and dusha is to be done, whereas Vata is to be protected. In the second case, Vata is subsided while protecting the dushas, which are forcefully dragged by Vata. Next slide. Similarly, in Shwasaroga, two varieties of Sampraptis have been described by Charaka for Shwasa and Ikaroga, that is Samanya Samprapti of Shwasaroga and Vishishta Samprapti of Shwasaroga. Next slide, please. Next slide. The quotation of Acharya Charaka and the Nidanas described by him are for Shwasaroga clearly indicates the vitiation of Kapha and Vata, both by their own etiological factors, which have been further enlightened by Chakrapani. The same set of Sampraptis have been mentioned by Charaka as Samanya Samprapti of Shwasaroga. However, both Sampraptis indicate the predominance of different doshas. In first it is Vata and in the second it is Kapha, which has been further clarified by Chakravarti as Kapha Purvaha. Iti Kapha Pradhana. Next slide please. Next slide please. In acute or allergic bronchial asthma cases, all the symptoms of Vata Prakopa are seen with secondary involvement of Kapha dosha. Vamana karma seldom provides better results. Snehapana and Virejana karma always provides better results. In case of secondary asthma, there is constant predominance of Kapha dosha with a lot of expectoration. Here, Vamana karma usually provides better results. Next slide, please. Vatarekta, Samprapti of Vatarekta forms an example of third type of Avarna. Avarna of Vriddha Vata by Vriddha Dushya. In this Samprapti described by Charaka, Vata is vitiated due to its own etiological factors. Rekta is also Vriddha. This Vriddha Vata is being obstructed by Vriddha Rekta, causing a condition of Rekta Vata. Here the treatment is to be done for both Vata and Rekta. Next slide, please. Next slide. Next slide. Avarna and its Chikitsa. Generally, Anabhishyanda, Snigdha, Srodho, Shuddhikaraka treatment should be given. Yapana Vasti, Prayaha, Madhura Anuvasana can be done. As Rasayana treatment should be given. Shilajatu, Gugulu, Abhaya Amlaki Rasayanas can be given. Leshuna is also indicated in Avarna treatment. As a modern correlation, Avarna can be taken as a pre-diseased condition. As said before, as Avarna can be taken as one of the steps in Samprapti. Next slide, please. Next slide. Okay, this all shows that Avarna can be taken as a pre-diseased condition when correlated to modern signs. Like in Avarna, the symptoms which have been said are mild symptoms. So that will also be that is seen in predisposed conditions. Next slide, please. Next slide, please. These are the studies which have been correlated to Avarna. Next slide. Conclusion. So by this we can come to a conclusion that Avarna is not a disease but a part of its Samprapti, which can be taken as pre-diseased condition. Only by constant practice and keen observation we can identify the symptoms if treated and if treated accordingly. Thank you.
Thank you, Dr. Kiran. Next, I invite Dr. Kiran Ramesh Dikshit.
Dr. Kiran Ramesh Dikshit, are you there?
I invite Dr. Kiran Ramesh Dikshit.
Doctor, please unmute yourself, doctor. Dr. Kiran Dikshit, please unmute yourself, doctor.
Hello.
Okay, doctor, your voice is clear, doctor. Please start the session.
Hello, madam.
Please start the session, doctor. Your screen is visible. Please.
Yes, you are audible, doctor. Please start.
Hello.
Hello, Dr. Kiran. Your voice is clear,
audible.
doctor. Hello, Dr. Kiran. Please share the screen, doctor.
Yes, ma'am. Hello.
Hello. Doctor, your voice is clear, doctor. Please,
Yes, ma'am.
please. Your voice is clear. Please start the session, doctor.
Hello.
Hello, Doctor.
Doctor, you are audible.
Hello.
Please continue, Doctor. Please continue.
Yes, my topic critical study of importance of Gopalivartak Nyay in interpreting Charak Samhita. I am Dr. Kiran Dikshit from the College of PMT's Ayurved College, Shogao. My guide is Dr. Vijay Dive, Head of Department, Samhita and Siddhant. Nyay is defined as a method and expression of general truth, logical expressions or principle. The Nyayas are used to visualize a situation, suggest of word. Nyayas are mainly two types basically on their utility, Lokik Nyay and Shastri Nyay. Epidemiology of Nyay. According to the Vyakaran Shastra, Nyay is defined as such a good way of going towards the real meaning. Significance of Nyay. The Nyay helps become the imperative. The Nyay convey the larger meaning than a sutra. Nyayas help to infer the ideology throughout the process prevailing at the time. Nyayas in the literature, Ayurveda can be classified into two categories, Nyayas in Mulfath and Nyayas in commentary. Method of analyzing the Nyay. Analysis can be done in 4 steps. Step 1, Padartha Jnana, the proper knowledge of the words in Nyay. Step 2, Prakriya Vijnana, eliciting the phenomenon that is implicated in the Nyay. Step 3, Sandarbha, knowledge of the context in which the Nyay is incorporated. Step 4, Yukti Praman, analysis of the Padartha Jnana, Prakriya of Nyay, which is in the Sandarbha in Samhita. Observation, Go means the cow and Balivardak means ox. Colonel G.A. Jacob has defined a Go Balivardak Nyay as a maxim of the Ayurveda cattle and bull. Similar explanation is found in the Tema Vasishtha Nyay and Brahma Parivartak Nyay. On a critical study of Charak Samhita, the present maxim is quoted by the commentator in the various contexts as follows. Sandarbha first, in Charak Samhita Sutrasthan Dirgham Jyoti Adhyay, during the description of intimate of Ayurveda by the Charkacharya, Chakrapani quoted in the Nyay in his commentary to clarify the word so Anantapara. Yukti, according to Yukti, Acharya Charak has mentioned that the sages involved in the great wisdom and devotion duly grasped the whole science of life no time. That is Ayurveda consisting of 3 main pillars in major contents. Chakrapani commentary while explaining the meaning of the word Anantapar. Chakrapani employed the present Nyay, that is Gopalivartak Nyay. In this verse, the word is Ananta without any boundary, and the mysterious word is Par. Sandarbha 2 is the Charak Samhita Sutrasthan. No Vegandaryanai during the description of external orifices. Acharya Chakrapani quoted this Nyay in this commentary to clarify the word Dushta, Dushtentaranti Kaini. Yukti interpretation. Acharya Charak has mentioned about the external orifices, that is 9 in number. These are affected by the Dushti, by their Matradikyam, increase in the quantity of mal and excretion. Chakrapani commentary, according to Charak, the Malayanani, external orifices of Mala, get affected by Dushti and their Matradikyam of Mala. So as per Gopalivartak Nyay, it has to be considered that the meaning of the word Dushta as a Kshina. Atra Parshabdena Gopalivartak Nyay Uchyute. Sandarbha 3. In Charak Samhita Sutrasthan Snehadhyaya, Agnivesh asks different questions about Sneha. Nyay is a commentary used to word Acha. Yukti, one among the doubts of Agnivesh is what vritti should be followed in the administration of Acha and Sanshodhana types of Snehapana. Chakrapani commentary. Acharya Chakrapani in this Ayurveda Deepika commentary mentioned about a Snehapan that is administered mainly 2 types of purpose, Sanshodhana and Samshana. In the above verse, the Charak, both the words Acha and the Sanshodhana are used. Sandarbha 4, Charak Samhita Nidan. Stanjora Nidan during the explanation of Vritti and Samprapti. Yukti. Acharya Charak has stated that diseases are categorized according to the origin. They are 2 points, exogenous and endogenous. On the basis of those variation, diseases are 3 types Vatas, Pittas, and Kapas. According to the severity, they are again categorized into 4 types: curable, incurable, mild, and acute. All these classifications come under the Vritti and Samprapti. Chakrapani commentary. Acharya Chakrapani in this Ayurvedic commentary mentioned as Vidhi means the virtue of variety. Here the diseases are classified under the virtue of variety as the doshaj, Nija, Agantu, GTC also started that the doshaj Vyadis are Sukh Satyaj Vyadis, dosh Dhamnej Vyadis are Krachya Shredani, Mrudu Asatya are the Yapya, Dhamanya Asatya are Pratyakshaya. Sandarbha in Charak Samhita, Chikitsa Stan Chardi Chikitsa chapter during the description of the Panchavid Chardi, Acharya Chakrapani referred this Yukti. Acharya Charak mentioned that Chardi 5 types: Vataj, Pittaj, Kapas, Sannipataj, and Dushtarda Chardi. Chakrapani commentary. Acharya Chakrapani in this Ayurveda Deepika commentary stated that the 5 variety of Chardi is caused by the contact with the disposal unwanted subject. This value of the object is by largest subjective in the matter, which differs from the person to person. According to Gobalivar, this term Dushta includes which are the unwanted, impure, and purified. Conclusion. By the above all references, it can conclude that the Gopalivardhana is employed in many instances of Charak Samhita where there is specific significant meaning other than the ordinary sense of meaning. In this manner, Gopalivardhana has significant role in the understanding Ayurvedic literature, and it qualifies the context by this application. Thank you.
Thank you, doctor.
Thank you.
Next, I invite Dr. Rajani to the presentation. I invite
Share
Dr.
my
Rajani.
Yes, ma'am. Can you just share my screen?
Okay, doctor.
Okay, doctor.
So it's not visible.
Not visible, doctor. Doctor, you have any problem with screen sharing?
Sir, I'm not able to see the screen.
Okay, doctor. I will share for you, doctor. Please start the session, doctor. Hello, Dr. Rajani. Please start the session, doctor. Hello, Dr. Rajani. Hello, Dr. Rajani. Are you there? Hello, Dr. Rajani. Are you there? Hello, Dr. Rajani.
Dr. Rajani.
Okay, next I would like to invite Dr. Susmi PS for the paper presentation, for the poster presentation. Dr. Susmi, are you there?
Yes.
Okay, doctor. Please share the screen, doctor.
Sorry, I can't share my. I'm not able to share. Can you?
Okay, doctor, 1 minute. Hello, doctor.
Hello.
Please start the session, doctor.
Okay. Good evening. I'm Dr. Susmi, first year PG scholar from Government Ayurveda College, Tripunithura. So here my topic for poster presentation is Shad Kriyakala. When we look into Vyadhi Kriyakala, it can be when we look into Kriyakala, it can be broadly classified as Vyadhi Kriyakala and Ritu Kriyakala. So Shad Kriyakala is a term used for Vyadhi Kriyakala, which is defined as various stages of a disease through which it progresses. So the reference of this is given in Sushruta Sutra, 21st chapter, which is Vrana Prashna Madhyaya. And we all know that Vrana is a disease in which clearly we can say various stages in that. So hence it is described in the Vrana Prashna Madhyaya. And now we'll look into what all are the 6 stages. Sanjayam, Pragopam, Prasaram, Sthana Samshrayam, Vyakti, Bhedam. Sanjayam cha Pragopam cha Prasaram, Sthana Samshrayam, Vyakti, Bhedam cha Yoveti, Doshanam sa Bhaved Vishak. The sloga goes like that. And these are the 6 stages of a disease. And in Sanjaya, it is the first Kriyakala. And the definition is Samhadi Rupa Vritti Saya. In that, Sushruta clearly explains the dosha-wise symptoms, where Vada is having Stabda Purnagoshtada, Pitta is having Pida Vipasada, Kapha having Mandoshmada, and Anga Gavrava. So while we get a patient in the OPD like Stabda Purnagoshtada or Anga Gavrava, we assume Chaya Rupa Vritti of the particular dosha. So hence it is very important to know all the stages.
Hello, Dr. Susmi.
Hello.
Hello, doctor.
Hello, doctor. Can you hear?
Yes, doctor.
Yes, was it audible?
Audible, doctor.
Okay. Was it? Have you heard what I said before?
Yeah, doctor. Please continue, doctor.
Okay. Yes, doctor. Okay, saying about Prakopa, it is the Vilayana Rupa Vritti. So a simile is given for Prakopa, like when we heat the ghee, it melts. So it is the Vilayana Rupa Vritti in its own sthana. And for Prakopa also, Vada, Pitta and Kapha wise symptoms are given. For Vada, it is Koshtatoda, Sancharana. For Pitta, Amlika Pipasa, then Paritaha, etc. And for Kapha, it is Hridayotpleda. And next is Prasara. Prasara is the overflowing of the doshas. That is, it travels after Prakopa, it's traveled through Srotas and spreads all over the body. And this is Prasara, and it is a symptom, the synonym is given like no, simile is given like Kinnodaka Pishta Samavayam. As the dough comes up when it is kept overnight, likewise the dosha spreads all over the body. And there are 15 types of prasara based on Vata, Pitta, Kapha and Rakta combinations. There are also symptoms for Vata, Pitta and Kapha, like Vata, it is Marga Gamana, Atopa, for Pitta, Osha, Josha, Paritaha, etc. And for Kapha, it is Arojaka, Avipaka, Ankasada, Charti, and all. And next is Sthana Samshrayavastha. It is the avastha in which the doshas get lodged in the particular organ or dhatu and produces specific diseases. And it is the stage in which we get the patients with Purva Rupa Avastha and Dosha Samurshana happens, and we get patients coming to us in the OPD. So it is very important to understand the Sthana Samshraya Avastha. Next is Vyaktavastha, in which Rupa occurs or the symptoms occurs clearly. Like for Jwara, it is Santapa Lakshana. For Pramaha, it is Prabodha Avalamotrada, likewise. And next stage is Bhedavastha, in which the Upadravas occurs. For example, in Prameha, it is Prameha Pidaga can be taken as the Upadrava. And importance of Kriya Kala, Acharya has said that Aprapteva Kriya Kale Prapteva na Krida Kriya. That is, when the treatment is done prior to the time, or Prapteva na Krida Kriya, when the treatment is not initiated at the proper time, or Kriya Hina Adiriktava, if the treatment is not proper or if it is inadequate also. Sadhyeshu abhi na siddhati. Even though the disease is sadhya, it will become asadhya. And one more importance is told like Samjaye abhada dosha nabandhe na uttaragadi na tu uttarasu gadishu bhavandi balavattara. If the doshas is restricted in the Samjaya avastha, it will not further progress to the next stage like Pragopa, Prasara, Vyakta, Bheda, etc. And if it is not treated, it will go on Balavattara and later on complications will occur. So this is the importance of understanding the Sthana, the Shat Kriya Kalas in clinical aspect.
Thank you, doctor.
Okay, thank you.
Next, I would like to invite Dr. Nimisha George for the poster presentation. Dr. Nimisha, are you there?
Hello.
Hello, doctor.
Audible?
Please share the screen, doctor. Audible, doctor. Your voice is clear, doctor.
Is my screen visible?
Yes, doctor. Screen is visible, doctor.
Okay. Good evening all. Myself Nimisha George, Department of Panchakarma, Government Ayurveda College, Tripunithara, Kerala. Today I am here to present poster on the topic Analytical Techniques in Ayurvedic Research. First, let's look on to the definition of research. Research is defined as a scientific undertaking which by means of logical and systematic method aims to discover new facts, re-establish and verify old facts, and to analyze their sequences, interrelationships, causal explanations, and the natural terms which govern them. Biomedical research, area of research devoted to the study of the processes of life, prevention and treatment of diseases, and the genetic and environmental factors related to disease and health. Aims and objectives of research in Ayurveda. Literary research, collection of available manuscripts and cataloging of this data. Drug research to standardize Ayurvedic drugs, drug dose, administration time, drug manufacturing process, and final products. To identify and standardize controversial drugs, to study pharmacological action of different Ayurvedic formulations. Clinical research, to assess results of different Ayurvedic treatments given in classical texts. Conduct clinical trials with an integrated approach involving other systems of medicine. Classification of research, pure and applied research, qualitative and quantitative research, observational and interventional research. Research design includes observational and interventional, descriptive and analytical, prospective and retrospective. Now, let's look on to the main topic, analytical techniques in Ayurvedic research. Analytical techniques are methods used for the qualitative and quantitative determination of concentration of a compound by using various techniques like titrations, spectroscopies, chromatography, etc. One of the main applications of this in the field of Ayurveda is the standardization of Ayurvedic drugs, which include various steps like authentication of raw material, assessing the concentration of foreign matter, pesticide residue, microbial count, extractive value, ash value, concentration of heavy metal contamination, etc. Looking on to various analytical techniques, first we can look on to the gas chromatography, which is used for volatile compounds. Different applications of gas chromatography include estimation of pesticides in raw materials, quality evaluation of raw materials, oil profiling of different oils. An example of one such study was to assess species richness and species diversity, where Piper nigrum leaves from Western Ghats of Kerala and Karnataka was subjected to GC, and the one with more therapeutic effect was assessed. Thin layer chromatography is the next technique used to isolate non-volatile compounds. An example of this study is one where leaf juice and leaf powder of Pongamia pinnata were subjected to TLC, and the difference in concentration of phytoconstituents in both samples were assessed. Later, the part with more concentration of constituents was used in the formulation to ensure therapeutic efficacy. Next technique is high performance liquid chromatography used for detection of aflatoxins, plant phenols, and flavonoids. Next technique is atomic spectroscopy, which is used for the determination of elemental composition of a sample. We are all aware of the scarcity of herbal raw materials, and many of them are often collected from roadsides, etc., which make them more prone for the heavy metal contamination. This technique can be employed to assess the heavy metal concentration of raw materials, atomic spectroscopy. Next technique is X-ray diffraction, which is used to determine crystallographic structure of a material. We can use this to assess the change occurring when raw materials are subjected to our Shodhana procedures. That is the change from the toxic form to non-toxic therapeutic form. Microscopy is the next technique. Authentication and assessment of medicinal plants and natural products can be done by this technique. DNA fingerprinting, new trend in fighting the adulteration of commercialized and cultivated medicinal plants. So let me conclude. We are in a scenario where Ayurveda is stepping into a global platform with WHO Global Center for Traditional Medicine being inaugurated recently at Gujarat. So it is the need of the time to explain our concepts, purification techniques, and treatment modalities to the whole world with strong scientific backing. Thank you.
Thank you, Dr. Nimisha. Next, I would like to invite Dr. Sumukhi Ravi for the paper presentation. Dr. Sumukhi Ravi, are you there?
Yes, yes,
Doctor, please share the screen, Doctor.
yes. Is my screen visible?
Yes, Doctor. Screen is visible, Doctor. Please start the session.
A very good evening to one and all. I am Dr. Sumukhi Ravi, second year PG scholar from Department of PG Studies in Chalyatantra from Sri Sri College of Ayurvedic Science and Research Institute, Bangalore. My topic of presentation today is Role of Manjashtadi Vikeshika in the Management of Dagda Vrana, a case series. Guided by Dr. Padma Bhatt, Associate Professor, Dr. Shweta Tyagi, Professor and HOD, Department of Shalyatantra, Sri Sri College of Ayurvedic Science. These are my contents: introduction, methodology, case series, results, and conclusion. Introduction. Burns are wounds in which there is coagulative necrosis of the tissue. Hence, it becomes the most devastating and painful condition, causing major physical, mental, emotional, and social trauma. Burns result from thermal, electrical, chemical injuries or due to exposure to radiation. Burn injury causes many more complications like cosmetic disfigurement, permanent physical damage, and mental trauma. According to WHO, an estimated 180,000 deaths every year are caused by burns. The use of ointments, oils, and other topical treatments is a messy operation that does not serve the objective of contact layer dressing. The need of the hour is to develop an eco-friendly, easily accessible, cost-effective way to treat first and second degree burns and avoid post-burn complications. In Ayurveda, different acharyas have mentioned in detail about types, lakshanas, and the management of Agnidagdha Vrana. In Vaishajya Ratnavali, Manjishtad Taila is mentioned for the management of burns by Acharya Govind Das. The Taila includes Manjishta, Takta Chandana, Murva, Tilataila, etc., which possesses the properties of Rakta Pitta Shamaka, Daha Prashamaka, and Vranaropaka. Considering the above qualities, this yoga is taken in the form of Vikeshika for the study. Burns are classified into grades or degrees according to the depth of necrosis. So, the first degree, there is simply hyperemia of the skin with slight edema of the epidermis. There is only microscopic destruction of the superficial layers of the epidermis, which are desquamated within few days. In second degree, the entire thickness of the epidermis is destroyed. Bleps or vesicles are formed between the separating epidermis and dermis. Vesiculation is the hallmark of the second degree burn. Now coming to the preparation of Manjishtadi Vikeshika. Manjishtadi Taila was prepared as per the classical reference of Taila Kalpana. Madhujishta was added to the Taila in 1:10 proportion respectively. 5 ml per 100 square centimeter of the Sikata Taila was impregnated over the gauze of 10 into 10 centimeter and covered in wax paper. After ethylene oxide sterilization, silver Ziploc packaging was done. The prepared Vikeshika was stored in a cool place. The sample of the batch was sent for the microbial study to ensure sterility before application. Methodology. The materials required were Manjishtari Taila Vikeshika, normal saline, sterile pads and roller bandage. Procedure. Duration of the study was 14 days. Wound was cleaned with normal saline. Manjishtadi Vikeshika was applied and dressed with sterile pads and roller bandage accordingly. After 14 days of the treatment, 7 days of follow-up was done. Coming to the case series. Case number 1. Patient aged 56-year-old female patient from Bangalore complains of burn wound over the right hand due to hot oil spillage since 2 days. No other associated complaints, no surgical history. So as you can see, this is a case of second degree burn with blisters. Patient had burn on 1st September 21 and the wound was cleaned and dressed with Manjishtadi Vikeshika, and after 10 days of treatment, that is on 10/9/21, the wound was healed completely with no discharge, pain on and surrounding edema. Coming to the case 2, patient aged 36-year-old male patient from Bangalore complains of burn wound over the right upper limb due to electrocution since 2 days. His patient had a history of OCD. So here is a case of full thickness second degree burn over the thigh region. So patient was treated with Manjishtadi Vikeshika and a very efficacious result was found by 21 days. Case number 3, patient aged 51-year-old female from Bangalore complains of burn wound over the right knee due to spillage of hot tea since 1 week. So this is a case of first degree burn over the right knee and the wound was dressed with Manjishtadi Vikeshika, and we had a successful result over 11 days of treatment, and the result can be seen here. Case number 4, patient aged 61-year-old male patient from Bangalore complains of burn wound over the medial aspect of the right leg above the medial malleolus since 5 days. So as you can see here, this is a case of second degree burn which was dressed with Manjishtadi Vikeshika and had an effective result with mild pigmentations over a period of 17 days of treatment. Coming to the assessment of the burn wound was done with the help of Bates-Jensen's wound assessment tool, and these were the results. Coming to the discussion, a fine fabric mesh or a gauze, Vikeshika serves the purpose by sustained release of this drug, thereby resulting faster healing. Vikeshika has helped in maintaining uniformity in drug application, and its sterility has lowered the risk of contamination. Acharya Sushruta has prescribed specific time durations for change of dressing depending on amount of srava and seasonal variations to regulate moisture in the wound and to give adequate resting period for it to heal, and was accordingly being done. Post-burn complications were negligible with Manjishtadi Vikeshika, and early pigmentation, that is, Savarnikarana, was also achieved. Manjishtadi Taila possesses the properties of Raktapitta Shamaka, Daha Prashamaka, and Vranaropaka. Conclusion: Manjishtadi Vikeshika is a cost-effective, easily applicable dressing material which would facilitate all the requirements for an ideal contact layer dressing and which possesses desired healing in the management of Dagdavrana. Manjishtadi Vikeshika dressing caused no irritation during the application in situ. There was negligible discomfort on every dressing change. The whole process of wound care seemed easy and effective. These are my references. Thank you.
Thank you, Doctor. Next, I would like to invite Dr. Geetu Casey for the paper presentation on the topic A Case Study on PCOS. Dr. Geetu, are you there? Hello, Dr. Geetu, are you there? Okay, next I would like to invite Dr. Geetu Krishna for the paper presentation on the topic Panchakarma in allergic rhinitis. Dr. Geetu Krishna, are you there? Next, I would like to invite Dr. Rajani for the paper presentation. Dr. Rajani, are you there?
Yes, sir.
Okay, doctor. Please share the
Sir,
screen,
can
doctor.
you share my screen?
Okay, doctor, 1 minute. Doctor, please start the session, doctor.
Okay, sir. Myself, Dr. Rajni Angdi, second year PG scholar, Department of Kaya Chikitsa, ALN Rao College, Koppa. Guide Dr. Prashant Bhatt, co-guide Dr. Vishnu Vinath. So today's topic is Trivida Pariksha and its application. The next slide. Introduction. Ayurveda is often called as Samakalina Shastra, a science of all times. Diagnosis comprises of a knowledge of etiology and symptomatology. Both includes pathology. The word pariksha is derived from root iksha, means to view, and to observe is pari. Thus, pariksha means observation from all the sides. Next slide. So next, moving on to the shloka. Trividam khalu roga vishesham vijnanam bhavati tadyataha aptopadesha pratyaksha anumanam cha iti. And another shloka has been mentioned in Ashtanga Hridaya, Darshana Sparshana Prashnahi Parikshecha Roginam. Next slide. Moving on to Darshana Pariksha. Shariram Upachaya Apachayam Ayu Lakshanam Balavarna Vikaradaya. This has been mentioned in Shushruta Samhita 10th chapter. So Darshana Drushtayaha Kasam Meha Dadyateshu Pita Shukla Varna Samsthanam Pramanam Upachaya Chaya Vinmutra Chardikam. Next slide. It includes variety of observations like color, shape, measurement, and complexion, natural, unnatural changes in the body. Example, Gridrasi, Katigraha, Pandu, Kamala, Pittaja Pandu, Paitika Gulma, Mridbhakshana Janya Pandu, and modern diagnostic procedures like X-ray, endoscopy, microscopic examinations, etc. Next slide. Sparshana Pariksha. Sparshana che Paninam Vikruti Yuktam according to Charaka Vimana 4th. It is examination by touch that can be Shita, Ushna, Shlakshna, Karkasha, Mrudu, Katina, Sparsha, Vishesha. Those interpretations can be found through Sparsha examinations. Next slide. Ushna Pariksha can be done in Jwara. Pranoti, Unnati examination of Shota. Vata Purna Driti Sparsha in Sandhivata. Sthanika Ushna. According to Yoga Ratnakara and Bhava Prakasha, Nadi also comes under Sparsha Pariksha. Next slide. Prashna Pariksha is nothing but interrogation, means that is questioning. Interrogation with the patient is most important in clinical practice. It facilitates doctor-patient relationship. History taking is an art. It is helpful in getting information about the patient, present as well as past illness. Next slide. Thank you.
Thank you, Doctor. Next, I would like to invite Dr. Geedu for the paper presentation. Dr. Geedu Casey, are you there?
Hello.
Hello.
Is it audible?
Audible, Doctor.
Okay. My topic is the slide is visible?
Visible, Doctor. Please continue.
Topic is a case study on PCOS. Abstract. Polycystic ovary syndrome is a multifaceted enigmatic disease. It has emerged as a major disorder which undermines the reproductive health of women. Incidence varies between 8 to 10%, more common amongst the infertile women. According to Ayurveda, the PCOS can be correlated to Artava Drishti and which involves the doshas like Kapam, Vada, Medas, Mamsam, Rektadadus. It can be considered as a Bahudosha Avastha, which needs a complete elimination of the vitiated doshas out of the Sharira, for which Ayurveda can play an important role, especially Panchakarma being a comprehensive part of Ayurveda, can achieve better results with a special type of purificatory procedures, which includes Pamna, Virejana, Anvasana, Niruha, and Nasya. A 23-year-old female patient was treated with various Ayurvedic medicines and Panchakarma. Keywords are PCOS and Panchakarma. Introduction. Polycystic ovarian syndrome is one of the most prevalent endocrine hormonal disorder in women, affecting up to 20% of the females in their reproductive period, leading to primary or secondary infertility. It's by far the most common, although the least understood causes of androgen excess, accounting for a vast majority of patients. PCOS affects 4 to 6% of the women. Approximately 75% of the anovulatory women of any cause have polycystic ovaries, and 20 to 25% of the women with a normal ovulation demonstrate ultrasound findings typical of polycystic ovaries. European Society of Human Reproduction and Embryology and American Society for Reproductive Medicine consensus meeting, a refined definition of PCOS was agreed, namely the presence of 2 out of the following 3 criteria, example oligomenorrhea and anovulation, hyperandrogenism, and polycystic ovaries with the exclusion of other etiologies. Clinical, biochemical, and metabolic features of PCOS include menstrual dysfunction, typically occurs in PCOS, ranging from oligomenorrhea to amenorrhea. As a rule, patients with PCOS exhibit anovulation. Severe acne in the teenage years appears to be a common finding in PCOS. Obesity is found in over 50% of the patients with PCOS. The body fat is usually deposited centrally, and the higher weight to hip ratio indicates the increased risk of diabetes mellitus. Cardiovascular diseases in later life, insulin resistance and hyperinsulinemia are commonly exhibited in PCOS. Insulin resistance is now recognized as a major risk factor for the development of the type 2 diabetes mellitus. Abnormal lipoproteins are common in PCOS and include elevated total cholesterol, triglycerides, and low density lipoproteins, and low levels of high density lipoproteins and apolipoproteins. Increased incidence of hypertension over the years reaches to 40% of the incidence by the pre-menopause. A greater prevalence of the atherosclerosis and cardiovascular diseases, and an estimated 7-fold increased risk of myocardial infarction. According to Ayurveda, some Praptikadakas of Artava Drishti are as follows. Hedus are Mityajara, and this includes Mityahara and Mitya Vihara. Abnormal diet includes spicy, oily, junk food, and abnormal lifestyle includes Vivasapnam, Ratri Jaganam, stress, and Pradushta Arthava. Under the influence of various hormones, cyclic shedding of the endometrial lining occurs, which results in production of menstrual blood. In patients with PCOS, dysregulation
Divasapnam, Avyayamam, Ruksha, Ahara Viharam, Abhishanti, Ahara Viharam, etc. And doshas include Kapam and Vadam, doshas including Rasa and Medas, Srodhas including Rasavaha, Medovaha, and Artavaha, Srodhas, Srodha Dushti including Srodha Sangam, Vimarga Gamanam, and Pratyatma Lakshanam include Artavakshayam and Saulyam. Pathophysiology of PCOS, Vishama Ahara and Vishama Vihara leads to body produces immature rasam which affects the menstrual blood and increases Medo Dadu Kapham and leads to Srodha Rodham and Srodha Dushti, Tridosha Gobam, incomplete metabolism and leads to hormonal imbalance. That's why obesity, hyperinsulinemia, and hyperandrogenism leading to amenorrhea, anovulation, and Grandhi Bodha Artavadushti, that is polycystic ovaries. And presenting complaint of that patient with duration, irregular menstruation since 1 year and loss of hair as round patches since 1 year. History of presenting complaint, according to the patient, she was apparently normal before 1 year. Then she noted irregular menstruation, but she didn't took any medication. She noticed hair fall as a small round patches. Then she consulted a gynecologist for the menstrual irregularity, took USG and found PCOS and took medication for 6 months, but the hair fall didn't reduce. So she consulted a homeo doctor and took medicine for 1 month, but she didn't got any relief. Then she consulted an allopathy and took medication. After so she consulted a homeo doctor and took medication for 1 month, but she didn't got any relief. Then she consulted an allopathy and took medication. After that, the intake of allopathic medicine, gradual reappearance of the hair noticed, and medicine continued till October 2020. While taking these medicines, she got small white round patches over both hands and she consulted dermatologist. While taking these medicines, again severe hair fall started. So she came to Ayurvedic hospital for better management. Then these are the history of patient, history of fast illness, no relevant history is there. Personal history, appetite, poor appetite, diet is vegetarian, increased use of pickle, bowel was hard, stool, menstruation was normal, sound sleep, no habits and addictions, allergies. Treatment history from allopathic hospital, she took hair lotions, Halox lotion, Lamatis serum, and Minochem N2 lotion. Menstrual history was menarche, 12 years of age. At the age of 12 years, bleeding 5 days, regular since few months. Gradually, the cycle became irregular. Period of 28-day cycles gradually became 34 and 40. Then the treatments we have done here was internal medications, Paranadi Kashayam 90 ml BD before food, and Abhyarishtam 25 ml BD before, after food, and Hingvachadi Churna. External treatments were Darshanam over the round hair fall patches with rough leaf and Indraluktamasti external application. Then Snehabanam with the Varanadi Kritam and Sugamaram Kritam for 5 days, first day 30 ml, then 50, 60, 90 and 150 ml. Then Sameeksha Snigdhata attained on the fifth day. Vamana with Kudajavijam and Ishti Kashayam done. Follow-up medicines were Mahatiktam, Gridam plus Narasimha Rasayanam and Richard capsule. Then investigations were before the treatment UST on 2nd December 2020. The right ovary was measuring 3.5 into 2.2 into 2.5 centimeters and left ovary measures of 3.6 into 2.5 into 2.5 centimeters. Both ovaries appear bulky in size and show polycystic pattern. Impression was bulky polycystic ovaries. And after the treatment UST on 8 August 31st, 2021, the right ovary was measuring 2.7 into 1.8 into 1.8 centimeters. PCOD was seen. Then left ovary 2.3 into 1.6 into 1.3. That's impression. Right ovary is PCOD. Then left ovary was normal. This is the picture of alopecia before treatment, and this is after treatment. Conclusion: Panchakarma is a special therapeutic procedure. It is a unique approach of Ayurvedic internal purificatory measure in order to eliminate the morbid doshas which are responsible for the disease out of the sharira and thereby revitalizing the tissues. These 5 kinds of treatments are designed for the transmembrane and visceral purification. As PCOS is a lifestyle disorder in which there is a Bahudosha Avastha, Shodhana is the only treatment of choice in order to eliminate. It can be well managed with Ayurvedic approach and lifestyle modification. Panchakarma can help in cure the disease without ill effects. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Shekhar Dattatreya Shejul for the paper and poster presentation. Dr. Shekhar, are you there? Dr. Shekhar, are you there? Next, I would like to invite Dr. Geetu Krishna for the paper presentation. Dr. Geetu Krishna, are you there? Dr. Geeta Krishna, are you there? Okay, next I would like to invite Dr. Ranjana for the paper presentation. Dr. Ranjana, are you there?
Hello,
Hello.
am I audible?
Audible, doctor. Please share the screen, doctor.
Yeah, sure. Is it visible?
Yes, doctor, visible, doctor.
Yes. Myself, Dr. Ranjana Aris, second year PG scholar Shalya Tantra from Sri College of Ayurvedic Medical Science, Research, Bangalore. The topic of presentation is efficacy of Gokshura Kashaya bladder wash in the management of Mutra Krichra with special reference to urinary tract infection. This is a case study guided by Dr. Shweta Tyagi, Professor and HOD, Department of PG Studies, Shalya Tantra, Sri College of Ayurvedic Science and Research, Bangalore. Coming to contents, introduction, case study, methodology, results, discussion, and conclusion. Introduction, urinary tract infection is a term used to describe acute urethritis and cystitis caused by microorganism. Urinary tract infection is a common disorder accounting for 1 to 3% of consultation in general medical practice. Long-term or frequent use of antibiotics may be harmful, and moreover, with rapidly emerging resistance to antibiotics, it is becoming increasingly difficult to treat the infection. Use of systemic antibiotics also places patient at risk for drug toxicity and adverse reaction. So with this aspect, need for an alternative therapy is essential. In Ayurveda, the disease Mutra Krichra is mentioned in almost all classical texts with different signs, symptoms, and treatment modalities, reflecting its prevalence in ancient period, which we can correlate to urinary tract infection. Dukkeda Mutra Pravritti is a classical feature described in our text, which is referred to as any discomfort during micturition or specifically the painful voiding of urine. Acharya Sushruta has explained the treatment of Mutra Krichra in detail by mentioning various internal medication, Anuvasana Basti and Uttara Basti. Numerous studies are done in the management of Mutra Krichra with the internal medications, but the lesser bioavailability of the drug through oral administration would lead to the long-term use of these medicines, prolonging the agony of the affected. Here, an attempt to study the effect of bladder wash with Gokshura Kashaya in the management of the same is taken. The choice of the drug Gokshura was done on the basis of its properties like Basti Shodhaka, Krimigna, Shotahara, Mutra Virechaniya, etc. Acharya Charaka has mentioned Gokshura as an Agri Dravya for Mutra Krichra, and also few studies have shown Gokshura to have anti-inflammatory and antibacterial properties. Even though in classic there are no direct references of bladder wash, a modified method of Uttarabasti for bladder wash is taken for the study. So my case study includes history examination, diagnosis and treatment. Coming to the case study, patient named XYZ with the age of 85 years, male, came to our OPD with a complaint of burning sensation and painful micturition with the duration of 3 years, which was on and off, and a medical history of being treated with oral antibiotics and catheterized multiple times. The patient had developed resistance to almost all the antibiotics, and there was no associated complaints or significant familial history noted. Investigations were done, that is urine routine and microscopic, which was suggestive of urinary tract infection, and the diagnosis was made as Mutra Krichra, that is urinary tract infection. Coming to the methodology, the materials required for the study were betadine solution, Foley's catheter, Urobag, artery forceps, sterile bowl, asepto syringe, lignocaine gel, 10 ml syringe, sterile glove, kidney tray, and Gokshura Kashaya. The procedure for preparing Gokshura Kashaya, it was prepared with all aseptic measures as per the classical references of Kashaya Kalpana. That is, 1 part of Kwata Churna was boiled in 8 parts of water and it was reduced to 1/4 the quantity. And the prepared Kashaya was allowed to cool down to the body temperature and double filtered using the Gora cloth. Procedure, with all aseptic measures, catheterization was done priorly, and then 200 ml of the prepared Gokshura Kashaya was pushed into the bladder using the asepto syringe. Catheter was clamped for 20 minutes and later it was unclamped and the fluid was allowed to drain into the Urobag. Bladder wash was done with the Gokshura Kashaya once daily for 7 days, and observations were noted on 5th and 7th day of the treatment. So this was the procedure. First image suggesting of the materials required for the catheterization, and the prepared Gokshura Kashaya was instilled into the bladder with the body temperature using the aseptic syringe, which is shown in the third picture. And this was how it was pushed into the bladder through the catheter. And it was clamped using artery forceps for 20 minutes. And the symptoms before treatment and after treatments were assessed, that is with respect to the pain and burning sensation. Pain before treatment was ranging from 4 to 6, which was moderate before treatment, and after treatment it was reduced to 1 to 3, which is referred to as mild pain. And with respect to burning sensation, it was graded as 4, that is severe burning sensation before treatment, and it was completely reduced to 0 grade, that is with no burning sensation after the treatment. And this was the test, that is urine routine and microscopy was done, which very clearly suggests that before treatment it was plenty cells which were seen, and during the 5th day of treatment it had reduced to 35 to 40 cells, and in the 7th day it had reduced to 15 to 20. Even with respect to the turbidity of the urine also, it had come down, which was hazy initially, which became turbid, and later at the end of 7th day it was slightly turbid. So this was how the urine routine looked with the course of treatment, and these are the original reports. So the results were complete reductions of symptoms along with the reduced pus cell counts, which was achieved in 7 days of bladder wash. Coming to the discussion, Gokshura Kashaya, having alkaloids, flavonoids, tannins, and phenolic compounds, possesses antimicrobial property, and also Acharya has included Gokshura and Crimigna Dashemani, and in the treatment of Mutrakritsra. With this, we may infer that Gokshura Kashaya used in the bladder wash may inhibit the bacterial growth by acting directly on the surface of the bladder wall, and flushing out the bacteria. Gokshura having Madhura Rasa and Shita Virya also helps in relieving Pitta Dushti, which plays an important role in manifesting infections with burning sensation. In the present case, Gokshura Kashaya bladder wash seems to have shown promising results in the successful management of urinary tract infection with ease and devoid of any complications. Thus, Gokshura Kashaya bladder wash helps in reducing the symptoms and thereby reducing the infection. Conclusion: significant relief on symptoms of Mutrakritsra, including burning sensation, painful micturition, pus cells, etc., was being observed in the course of treatment. There was better recovery and sustained therapeutic effect in the patients with Gokshura Kashaya bladder wash, thus paving a way for the treatment with ease in case of resistant and recurrent urinary tract infection. These are my list of references. Thank you.
Thank you, doctor. Before the end of the session, I will call again those who are not present today. Dr. Mahesh Pandit Kore, are you there? Dr. Mahandesh Hayarmath, are you there?